Bwrdd croeso, good morning and welcome to today's board meeting, public board meeting, the first one of 2023, which I know is going to be a year which is going to bring its challenges, but also a year in which I'm very much hoping we're going to be making significant progress in some key areas of our work, one of which we're going to hear a little bit about later. As is usual, our usual approach, this today's meeting is being held virtually through Zoom. The meeting will be recorded and people will have an opportunity to listen to the recording via a link on our website. Simultaneous translation facilities are available, and for those people watching today's meeting who aren't familiar with how to access that, if you hover your cursor over the screen, you will see a little globe at the bottom. I think it's usually the third in from the right on the icons. If you click on that and select Hear Translation, if you wish to hear the translation of anyone speaking in Welsh this morning, and if you leave it on that channel, you'll get both the English feed and the translation feed. Board members, as is often the case, working virtually, might not necessarily be looking at the screen. We apologize for that. We'll be looking at our papers. We will be taking a break during the morning, and we're scheduled to finish the board meeting today at around about 1:25. As you're aware, board members, hopefully if you had anything on the consent agenda, you've already brought that to the attention of Chris. I'm not aware of anything, so do mention it when we get to that point in the meeting. It gives me great pleasure to welcome our final appointed executive director to today's board meeting, his first board meeting. I think you've been with us about a fortnight now, Sam Lloyd. It does present me with a challenge of having two Sams on the board, but I hopefully you'll bear with me if I call the wrong Sam at the wrong time. Sam, I don't know if you'd like to say a few words by way of introduction.
Thank you, Simon. Morning, everyone. I'm very pleased to be here. I'm currently 9 days in, so learning a lot about the organisation, but it's clear to me already that we've got some great people and a really important mission. So I'm very excited to be here and to be part of it. Thank you. Great,
and we're looking forward to working. You've been part of the DHCW team, Sam, so welcome. And also welcome, you can't see them at the moment, to Matt Cornish and Joanne Dundon from the DSPP programme, which we're going to hear about in a little while. Apologies for absence. For apologies from Marilyn Bryan-Jones, who had a prior commitment. She's hoping to be able to join us through the morning, and I know that Alistair may have to leave us at short notice due to a family commitment. So Alistair, please feel free to do so if necessary. Declarations of interest. None have been communicated to me prior to the meeting. Just quick ask if anything has occurred to anyone since receiving the papers. No, thank you very much indeed. If I move on then to the consent agenda, as I said, nothing has been indicated to us, and I don't think it looks like there's anything anyone wants to raise. Okay, there's a minor correction. It's a minor correction to the minutes, but a major correction to public policy. In the minutes it mentions the confirmation that national insurance would be funded by the government, but as the Westminster government have now removed the national insurance hike, obviously we won't be getting cover for that hike from the government. So that has been amended to reflect the actual position as it stands now. If I move then on to the items we've been asked to approve and note, people happy to approve the minutes from the board meeting held on the 24th of November, subject to that minor change I mentioned. Thank you. If we happy to note the action log, noting that there's 1 action is underway and 10 are complete. Thank you. And then noting the forward work plan and the COVID-19 inquiry update and the end of year reporting arrangements for 22-23. People happy to note all of those. Thank you all very much. So then, as I mentioned briefly earlier on, if we move on to the shared listening and learning presentation, which I'll invite Rydian Hurl, the Executive Medical Director, to tell us what that is about and to introduce Matt and Joe Dundon to to the meeting today. So over to you, Rydian.
Thank you very much, Chair. Good morning, everyone, and Happy New Year. It's a great pleasure to invite Matt and Joe, and shout out to all the other colleagues who've been involved in this programme. Navigating healthcare systems and services is complex. It's complex for those who work within the healthcare. So knowing what is happening can often be very difficult, and it can be frustrating. This programme aims to make it easier for patients and the public to access services that can provide them benefits. And these services are often focused on improving disease self-management, improving independence, signposting to prevention, and empowering patients' choice. And I think you'll enjoy this presentation, and I look forward to questions at the end.
Good morning, everybody. My name is Matt Cornish. I'm the Co-Programme Director for Digital Services for Patients and the Public programme. Joe and I will be jointly presenting and answering questions. This programme comes to at a really, really important time, so we're delighted with this opportunity to be able to show you what we've been doing in terms of the development of the NHS Wales app and bringing it into the hands of real people to be able to look at it, assess its use, and provide us with feedback, which is important to us so that we get the deployment right. So if you go on to the next slide, please, Hannah. Very brief agenda. We're going to set out a bit of an introduction to the programme itself in terms of what it's aiming to do, then a demonstration of the NHS Wales app so you can see what we've done, how it looks, how it feels, and then our future plan ahead. I'll then take a little bit of time to walk through what we've done already, that private beta, that approach, and the learning that we've done in terms of working with real people, and then how we're taking that learning into our broader adoption approach into our public beta. And then we'll be very happy to take any questions which you may have. So next slide, please. Okay, at the top of the slide, DSPP, Digital Services for Patients and the Public, and you'll see our maxim, joining the dots with digital services. We see ourselves as a key enabler, an enabler which was envisioned number of years ago, but envisioned and supported by Welsh Government to help us to deliver better joined up care, to help it ease pressure on health services, and I think we'll all understand that at this particular time, but also to help health providers to join up care and ultimately to be there providing benefit to citizens. Now we are about the NHS Wales app, and that's probably the part which is most above the surface. But below that, we're very much interested in the standards by which other services will integrate together so that through one particular resource, the patient or the citizen can engage and can take a more active part in the way that they manage their whole health and care. Now, as has been described, the programme was set up in March 2020, but it really gathered pace at the end of 2021, when we brought on board a delivery partner which had worked in England on their particular app, and then looked to build it in less than 11 months. So a really, really accelerated programme of development, which we then took into the hands of the public. The programme involves a team, a core team within DHCW, but also from partners from across the health and care landscape in Wales, so from every health board and trust, and also from social care, working collaboratively together to make this programme and the delivery of the NHS Wales app everything that we want it to be for citizens. We did take the NHS Wales app into that private beta starting in October. And a little bit later on in the presentation, I'll bring that feedback very much to the fore. So if I now ask Hannah just to play the demonstration of the video, this will be really, really important because it really set out what we've done and give you a real rich illustration of how the NHS Wales app looks, how it feels, and the potential that it can provide. So over to you, Hannah.
The NHS Wales application's first release, private beta phase, will be to a pre-selected group of approximately 1,000 users in 10 practices across Wales. This testing phase will enable us to capture real feedback from users within a production environment, and we can use this data to further refine the app before we roll out to a wider audience in Wales, known as public beta. Account authentication and verification will be possible with the NHS login. Users will be able to use their smart device capabilities such as fingerprint and facial recognition to access their app. For users who do not have access to such devices, a website version is available, allowing access through a similar, password-protected and safe process. The NHS Wales app has been styled and branded in accordance with the NHS Wales brand toolkit, and also meets the strict accessibility standards and will be accessible to audiences who are visually impaired. We have worked with user design and content experts in partnership with members of the public to create the content provided through the app. We've also worked with qualified and approved Welsh language experts to ensure the content is clear and correct in Welsh. Users will be able to access the app on their smart devices or website in their individual language preference. The first of our live integrations with services already accessible by the public in Wales allow users to easily navigate to the 111 service to get help with their symptoms, find local services and access health tips. Users will be able to access the 111 service content in their preferred language as set by their NHS Wales app, English or Welsh. As you can see, the service now displays in English, picking up the preference from the NHS Wales app. Users can book GP appointments as enabled by their GP practice. Users can request prescriptions from their GP as enabled by their GP practice. Users can view their medical records online as enabled by their GP practice. Another integrated service where users can also update their donation preferences. And finally, a range of articles have been created to support users who may need more help or want further information. Throughout the private beta phase, we will be engaging with end users and GP practices to identify any further resources which may help them. New functionality which has been built and will be coming in future releases includes the About Me data. The timeline, a chronological view of users' health events, and a journal to help capture their own entries. The ability to rebook a vaccine appointment, and the ability to update their demographic data held by the GP system. And this is just the beginning. We have a growing roadmap of new functionality to explore and build to bring further value to the citizens of Wales.
I'll just let the music play down. Hannah will now bring us back to the presentation. And I want to talk next about the experience in private beta, because I think that'll add a lot of real richness in terms of what we've done. So on to the next slide, please, Hannah, or a couple of slides through. Wonderful. Right, this slide is really important to us because we wanted in our private beta to involve real practices who wanted to work with us. And so what we sought to do was to be able to collaborate with 10 practices spread across Wales but were interested in exploring the private beta with us. Now, all of these practices were supported by a particular system supplier, system called Cegedim. Reason for that was that that system was available to work with us at the time. We were waiting for the second system supplier to come on board, but the learning which we've got from these practices is transferable across all 379 practices in Wales. So 10 practices, a number of important characteristics of those practices, some very urban, some very rural, every health board area in Wales involved, but sharing a lot of similarities in terms of their willingness to be part. If we go on to the next slide, please, Hannah. It was also important to us, as well as identifying practices, to identifying a cohort of citizens to work with who were as representative of the 3.1 million people in Wales as we possibly could find. And so we worked with practices to set in some important conditions in terms of age, in terms of gender, in terms of ethnicity, in terms of familiarity with information technology, in terms of whether they were a carer or needed support. We sought to make it as broad as we could and gain feedback from important representatives on our patients and public assurance group to show that sort of 1,000 citizens that we invited to be part of our private beta would truly be as representative of the population as they could be. If we go on to the next slide, please. And the next slides really reflects what we did, starting on the 17th of October and then completing the active phase in early December. What we sought to do was to invite our selected participants to carry out some set tasks for us over the course of that period. And that started off quite simply in terms of switching language or accessing the NHS Wales app via biometrics. And when I'm talking about the NHS Wales app, I'm also talking about the website because we dealt with both exactly in the same way. Over the course of the period, we were able to onboard 706 registered users. We did dive into reasons for why people hadn't chosen to take up that survey, and largely it was because of time factors which didn't allow them to commit. What that meant was that across each of our 10 practices, we had a minimum of 63 and a maximum of 80 citizens participating, which we felt was a really, really good spread. And over the course of the beta period, we also asked them to carry out other set tasks in terms of ordering repeat prescriptions, if they were due to do, to be able to look at their medical record views, and also to be able to book appointments if they were made available, and then be able to show that the technology works and to cancel appointments. We also asked for lots of feedback. Not initially in the first week, we just wanted feedback in terms of whether there was an issue, but we thought that there was a chance that we'd be skewed in our views of just focusing on issues. So we asked for satisfaction feedback after each of those respective tasks, and satisfaction feedback to come back to us in both English or in Welsh, whatever was the user's preference. And over the course of that period, we analysed every piece of feedback and then we put it into themes. And so the next slide, which I'm going to describe to you, sets out the key themes of feedback which we described, as well as key bubble feedback, in a sense, of what people were saying to us, which I think will be really, really informative. So go to the next slide, please, Hannah. Oh, sorry, slide after. So user satisfaction. Over the course of our beta period, our satisfaction graph remained pretty consistent in terms of, around the half to 70% of people either somewhat satisfied or very satisfied with their experience. As we weren't down the continuum, we did try to understand why people were not satisfied. Was it to do with their experience and the interface of the NHS Wales app? Or was it more to do with actually the services being provided, which we have a lot less control over, whether, for example, a GP practice chooses to turn on appointment booking or the content of their medical record. And so I think that's the part which I'll bridge on to the next slide. So next slide, please, Hannah. Okay, so this is the real action slide in the nicer sense of this presentation. So what we found from engaging with users is that they found it easy to be able to log on. They found the biometrics easy in terms of changing those. They found it easy to jump off to the 111 service and access that, and found that a really useful addition. They also found it easy to be able to look at the organ donor service and bloods, similar to the 111. There's a couple of points which I want to draw out. So we did find in the nature of private beta, but there was a fingerprint issue. So an issue with users being able to access the NHS Wales app through a particular type of Android device, which were thanks to joint work between our colleagues in Canos, who are our delivery partner, and colleagues in Cegedim, we were able to triangulate what the issue was to be able to put in a fix, be able to show that the fix had worked, and then go back to the users and then confirm that it was working for them. So that's why that issue is flagged as green, as opposed to what you'd normally think of as red. When appointments were available, we found that users, it was easy to book appointments and to cancel. The areas that red, which are towards the top of the slide, really reflect what we probably expected, i.e. that if an appointment wasn't enabled, then the user wouldn't be able to book the appointment. And so they provided us with objective feedback, but to some extent, there was some disappointment in that. And I think if you look at the bottom right of the slide, there's a user feedback in terms of the challenge of appointment booking and wanting appointment booking for that, but that appointment booking not being made available within the GP practice. Now, our approach has always been to work in collaboration with GP practices and to be able to show where appointments are going to be able to add value, and so that people can understand the benefits of that and then to support broader adoption. We definitely don't come with any sort of stick. We're very much focused on reducing the costs of any adoption and it helping to be able to deliver improvements which are going to benefit people. Other feedback on this certainly reflects the ease of being able to be able to make repeat prescriptions, certainly in comparison to the existing system via My Health Online, which was really pleasing for us. And so a lot of this feedback actually really emphasise the value of the iterative staged approach to testing, so that we can ensure that the services we offer meet the needs of end users and also meet the needs of those service users who need to in turn support citizens. So next slide, please. The plan for public beta, and this is important. We recognised that just going to a big bang, making the NHS Wales app available to all practices at the same time, presented significant risk for them at a time when they're exceptionally busy meeting current demand. And so what we thought we needed to do was to work with a limited controlled group of practices, as we had done in private beta, to be able to explore learning, to understand what would need to be in place to support a broader rollout. Again, focused on vision supported practices initially, including those 10 private beta practices, which I flashed up on an earlier slide, and including other practices who we've assessed as being really well prepared and ready to support adoption. So we've got another 10 geared up, ready to start. We also need to work with the EMIS supported practices, and we've got a plan to be able to do that when an important interface is in place. And so that will help us to support adoption across all of Wales, which is really, really important to us. The next kind of line below, in terms of expanding the number of users in a controlled way, is very important. Now, because of the feedback which we received about users being able to easily manage repeat prescriptions and the like, it makes sense to use those people who are familiar using that My Health Online functionality, which is directly related. And so we've got an approach which would seamlessly introduce people towards the NHS Wales app. We'd also look to specific practice promotion activity to bring other people on board as they're able. And then later on, once we've got sufficient spread and we've done a lot of learning across Wales in terms of the adoption, we then look to gear up the national campaign to encourage adoption by citizens all over Wales. But I would add the first two steps are really important to us, so we can manage those and ensure that what we do deliver to all citizens is what they would want. And of course, the DSPP engagement team would also carry out activities to support practices and to support citizens. And I'll talk a little bit more about that below. We are developing features all of the time, and the functionality available in the NHS app will continue to mature and will continue to improve. And there'll be no end point to that. So that's also important to us. In terms of the support we're providing to practices, well, we've developed a toolkit, which we've took in private beta and have worked with them on its onward development. We're also providing responsive e-learning and training, which would both help practices and provide effectively a surgery for any issues which they encounter, so that they can directly support citizens as well. We're also working with Digital Communities Wales and a whole host of voluntary organisations to be able to provide support in community hubs, so they in turn can provide direct support to citizens who may have issues about connecting in the digital landscape, or not just about the NHS Wales app, but also how they can make the journey and access new channels into the future. So I'll pause there. The last slide is a question slide, and then Joanna and myself will be very happy to receive questions. Thank you.
Thank you, Matt. Just before, while people put their hands up if they wish to come and ask any questions, it might well be worth, particularly for people who are watching, members of the public who are watching, just explaining what vision and EMIS are, because it's not everyone will be aware, Matt, and it is critical to the development of the app and the rollout of the app.
I can. So the practices, GP practices across Wales, are supported by various system suppliers, and there are two in Wales, principally two. One called Vision, one called EMIS. They operate in England as well, but they're important to us in terms of the way that the app interacts with those particular practices. And so we've got to work collaboratively with them in the nature of how we deliver services.
Thanks, Matt. Very clear. David and then Rowan.
Thanks, Simon. Thanks, Matt and Joe, for the presentation. Great to see the progress you've made. Really good start. One of the concerns that got flagged up when you made the presentation to the All Wales Independent Members Digital Network was the take-up of GP practices. And I noticed the feedback. One of the challenges we've got is the availability of appointments. And I know from my own local surgery, which is one of the surgeries participating, they used to make appointments available online, but they stopped that a little while ago. Am I thinking along how do we sort of break the sort of getting GPs to put appointments online? One of the things that occurred to me is if we had some sort of triage service in the app, which actually sort of took you through and maybe pointed you at Choose Pharmacy or actually over-the-counter medication or an appointment with a nurse before you actually got to a GP appointment, the GP practices would be more likely to make things available. So with the link to the 111 service, does that actually take you through some sort of triage process? And could we then sort of close the loop with somebody who's gone through that and does need to see a GP, then the GP practice maybe would be more prepared to make an appointment available?
So really, really good question. Thank you, David. What I would say is that we've recognised that there is a need for a care navigation solution, and you've talked about an e-triage to be able to ensure that the functionality within the NHS Wales app, which is that core booking functionality, is being able to be used effectively, because we recognise that, we're not expecting GPs to just, turn on everything because, they can't, they're fairly constrained. But there are, particular types of appointments which we feel would be more suitable, as you've described, and it might be some particular nurse-led appointments, it might be other appointments. So it's understanding what appointments would best fit. We have some discovery activity which is planned in this space, which will help us inform how we see to take it forward. The challenge, no, it's not a challenge, the opportunity is working collaboratively with those GPs to be able to determine how that could best be implemented. So I think the discovery first, working collaboratively with those GPs and practice managers within that discovery, and then we'll have something which really adds value, because trying to, in a nicer sense, beat somebody on the head to say, no, you must offer appointments is not going to work. And we know that. And the point on 111, we had done some work with 111, we're doing some work on a symptom checker, which would help people to effectively manage their particular care and signpost different providers, healthcare providers, for the type of condition which they've got. So it's something which exists separately, but via the 111 service, which is a core within the NHS Wales app, or a jump off within the NHS Wales app.
Thank you, Matt. At some point we make group questions, but we'll take them individually at the moment. Rowan and then Ruth. You're on mute, Rowan, I'm afraid. First of 23.
Thank you, Matt. Really interesting. And I suppose what I took from that presentation was, I think we've conceived of this as a sort of in business parlance, a business to consumer type relationship. You know, the healthcare provider reaching out to the citizens. But what I heard in that presentation, that there was actually the classic, very important business to consumer relationship. And you gave us feedback about what members of the public thought, but I didn't hear feedback from you about how the GPs felt the app had changed satisfaction behaviours, how it was supporting them. Have we done any feedback on that? And perhaps you could summarise that for me.
I can, and that's a really, really good question. Yes, we have. So immediately after the active phase of our private beta, we engaged with all 10 of our practices to understand the impact on them and the thoughts on their experience. And this, I suppose, supported earlier work which we've done with the practices, which focused on their hopes and fears to see whether those hopes and fears had materialized in any way, and also their feedback on the GP toolkit. And so those practices were able to give us encouraging feedback in terms of their experience. But what I would add, and I should bring Joe in a minute because Joe was closer to this, but of course we were scratching the surface to a degree. As I mentioned, you know, we had 63 to 80 citizens in each of those practices which were involved, you know, not 5,000 or not 6,000 who were involved. And so the impact, you know, was relatively light. I don't know if Joe wants to add anything in on that. Joe.
Sure. Thank you very much, Matt. So, yes, we also ran a survey with the practices, all the practices in Wales, asking would they be interested in taking part in public beta. And so we got a lot of feedback from them. And there's about 57 practices came back saying they would be really interested in taking part in public beta. I think because of the functionality was very similar to My Health Online, they didn't really feel that there were that many issues that were really different from what they were experienced before. And we did, in the baseline, as Matt said, ask, you know, how comfortable do you feel answering questions on that the patients might have coming in, and all of them had very high competency for that. So I think as we move into public beta, there'll be probably more questions and more feedback that we can get, which would be really, really great to add to that rich tapestry of info.
Thank you. Ruth and then Marion.
Thank you. Thanks, Matt. Thanks, Joe. You know that we've spoken a lot about the NHS app and DSPP generally. I wonder if you could just speak a bit more about the fact we can't deliver this in isolation, and how does this link in with the wider primary care programme, accelerated cluster development, and other things that are happening in that space in order for us to better be able to access GPs, help them to help us.
Yeah, shall I come in there, Matt? Because obviously there's a relationship with our GP colleagues across Wales through GPC Wales and the networks that we've delivered. Digital Healthcare Wales has recently employed 5 part-time GPs to work both as a regional network and engagement, to work with practices to collect data, to engage on the benefits. The big benefit to GP surgeries and to the patients themselves is empowering them to make choices which mean they don't have to go to primary care, to utilise pharmacy services, to utilise high street providers, and to reduce the acute pressure. We need to be cognizant of the reducing number of GPs in Wales. We've now dropped below 400 practices across Wales. They need support in a different way. This is an important tool that we will use gently where they need it to help them deliver the services that they're empowered to deliver.
Thank you, Ridian. Did you want to add anything, Matt, or shall I move on to the next question?
The only thing addition I'd add is, we've been very closely connected with the strategic programme for primary care. We recognise that they have a key role with all of their clusters. And certainly insofar as, you know, keeping them well appraised of our plan, looking to establish closer relationships with them, because, you know, even though our task is smaller than that of England in terms of adopting 6,500 practices, you know, the just under 400 described, it's still significant, and we want to get it right. So we want to work with everybody who can help us in that task, and are working very closely with primary care at all levels.
Thanks, Matt. Marion, and then Alistair, and then Helen.
Diolch Cadeirydd, I'll speak in Welsh if I may. Diolch yn fawr Matthew am yr cyflwyniad yna, diddorol iawn iawn. Da ni wedi dysgu lot, dwi'n siŵr, ynglyn ar y brawd. Mi gyfeirio chi at yr app yn Lloegr a'r bartneriaeth sydd wedi bod yn digwydd efo dros y ffin. Ga i ofyn beth ydych chi wedi ddysgu o sefydlu'r app yn Lloegr, ac yn ail beth, faint ydych chi'n anelu at ddefnyddio, faint o gleifion, faint o boblogaeth Cymru ych chi'n anelu at ddefnyddio'r app yma yn y pen draw? Be fydd llwyddiant i chi? Ac yn drydydd, efo gymaint o'r datblygiadau yma, be da ni'n weld yn aml iawn ydy bod gyda ni ganran o'r boblogaeth yn dal i gael ei hamddifadu, tlodi digidol. Sut ydyn ni, a mae hwn falle'n gwestiwn i'r Rhydian ac i Helen falle, sut ydyn ni'n mynd i sicrhau na gyda ni ddim yn dwysau'r elfen yma o dlodi digidol, a bod pawb yng Nghymru yn mynd i fod ar yr un safle?
Thank you very much. I think I caught all three questions, and so I'll deal with them in the order that they were provided. So learning from England, but we learned from England, but we're also learning with colleagues in Scotland as well, who've also got aspirations to develop an app, website, similar presence. So the deployment in England, which goes back around 4 years, was to a quite strict political imperative. So a particular date for them to launch their app, big scale, across England. Which caused quite a number of challenges, certainly in terms of the adoption on a practice by practice basis, because it was made available to all, and there were, you know, a great number of issues, you know, uncovered from that mass deployment, which took time to be able to address, and the time that it took to address, there was, you know, effectively a damaging of confidence amongst those GP practices. Now, over the course of that first year, they pushed and pushed and pushed, and just about achieved 1 million downloads of their app. But the COVID factor and the requirement to be able to have a COVID pass really caused a mass acceleration in terms of the number of downloads. So they went from just over 1 million to around 30 million downloads in little over a year in the second year. So we've taken a lot of that learning, and we don't want to repeat that. And so when we went to speak to the Minister for Health and Social Services and outlined our broad deployment plan, we wanted to talk about iterative, managed deployments, working collaboratively with people so that we can meet their expectations, as opposed to setting something entirely unrealistic, you know, and then finding that we disappoint along the way. So that's kind of the England experience, and we're very much, you know, engaged in regular conversations with colleagues in England and with Scotland about those experiences. And Scotland are very interested in our learning from private beta and our approach into public beta to benefit from that, and we're very keen to be able to share. In terms of the successes, now this is an interesting one, because, you know, our needs of the services within the NHS Wales app and website will change over the course of our lifetime. So for some of us, we might need the functionality enabled in repeat prescriptions immediately. We might want to be able to access a GP, but for others of us, it might not be of particular interest. We're also developing a whole suite of resources, which will be in a curated store within our app, which will address people's whole range of health and care needs. They might have various jump-offs to those services which might be of particular interest. And in so being, we've got, in a nicer sense, tailored services to people, which will change over time. And we're looking very much at the prospect of, you know, enabling proxy access so that we can care and support relatives of whatever age. and also for the NHS Wales app to be there at the very start of our life, right the way through to the very end. So there's a lot which is wrapped into that, and we're not wholly focused on just downloads, because that's not the whole answer. It's the value which people get from within the app and the services connected, which is most important to us.
Thanks, Matt. Alistair, then Helen, and Rowan, you want to come back in?
Thank you, Chair, and thank you, Matt, for what was a really interesting presentation. I was interested, just 2 or 3 questions if I may. I was interested if it would be realistic in context terms to recognise that we're playing catch up in Wales as opposed to taking a lead, as it were, by comparison to other Western European economies. I don't know if that's true, but the context of where we are in that, I'd be interested in. In terms of just some specific questions around the app, very interested in whether we can develop prevention through the use of the app. And the thought is, in the England app, there is a Your Health component on it, as you'll be familiar with, Matt. And I don't think that's fully exploited in England at all. I'm very interested to see whether or not that's something that could be developed and enhanced in Wales for the range of obvious applications, from diet to exercise to, this time of the year, diet obviously plays a big part of people's thinking. And by the time you get to February, they're probably thinking more about Valentine's Day or something than their diet, but how we can use prevention to play a really important part. I was interested in the comments from a couple of the elements of feedback bubbles that you included, which indicated no access to medical records and test results. Don't know if that's simply because of the pilot. In England, you do have access to medical records, test results, and so on. So just clarification on that would be helpful. Also, again, in England, this has proven to be a problem, and the COVID factor you referred to, Matt, is one that, we certainly don't want another pandemic to accelerate uptake, but it does create the question, how do we get that uptake? At the point that we really do develop the uptake, I think we're likely to anticipate what they did have in England, which was the age demographic difficulty, which is potentially a real dilemma, that the barrier to access can very often be greatest in the age group who might most need to make use of the app, and how we break through that particular paradox is going to be challenging. The upside of that is that we are probably far more playing into a younger group with the access to the app. And again, that plays us into the prevention agenda. How we can actually make greatest use of that would be very interesting to see. So just 2 or 3 points there, and thank you.
Matt, I think I'll come in there because I just wanted to shorten it to give other people to have an opportunity. First thing to say, Alistair, this is an all-nation approach. What you've seen in England is a disease-specific oriented approach, so ischemic heart disease, diabetes, etc. There's obviously a complexity about what we've learned from the previous implementations of My Health Online. You're quite right about the opportunities. This is a single door into a system, and from that point, you can signpost. So from your medical record, you might be able to identify that an individual smokes, and then you can nudge that person to go quit smoking, or there'll be things for other lifestyle choices. The other opportunity is screening alerts, which is important. Our approach is that this is a trusted source of information, so we need to be careful to make sure that those sources are validated, are approved both by patient representative groups and also by the medical profession. The no access thing, that is a lesson learned, and we're well aware of relating to that. What can GP services provide? What can online pharmacy provide? Directory of services, all of these things need to come into a structured way. I would challenge you on what's available in NHS England, my friend. The media and the publication is often more than perhaps that is on the ground. Barrier to access, we're well aware of the inverse care law. Those that need access often don't. And we will work collectively with the user interface people, the different types of accessibility, access in terms of can you get this on a high street if you don't own a mobile phone? All those sort of things are within the round. So thank you for bringing them up. I'm absolutely confident they're on that work list that Matt has got and started to present.
Brilliant. Can I just very quickly?
Very quickly, because there's three people wanting to come in.
Quickly, it would be worth considering local authorities and social care, adult social care, as a route through to those very people that we want to be able to take it up. Thank you.
That's a good point. Helen.
Okay, Helen, Joe, by the way, oh, you're on mute now. You weren't on mute, you are now. Helen, then Rowan, and then Ivan, and then we better come to a conclusion then.
Thank you, Chair, and thank you, Matt and Joe, for really good presentation and an overview of where we are. A couple of comments from me, and then perhaps something for Matt to expand on. Just picking up the work around GP appointments that David talked about earlier, and the challenges around access to appointments and picking up kind of access to particular services. We are, as Matt said, working really closely with the strategic programme for primary care. There's a lot more that we will be doing in that space, but actually that's about us working with that transformation programme and understanding the service models that are being taken forward, and how then the app and other digital services and information services that we provide actually is going to support that transformation work. So it's very much a partnership approach that we'll take with that. And then on Alistair's point around, no, actually it wasn't Alistair, I forgot, it was Marion, I think, on digital inclusion. I think, again, that's working in partnership with local services and transformation programmes, and as Alistair said, actually local authorities as well, so that we are not broadening the inequality that we have at the moment, so that we are providing equal access, both from a digital perspective, but of course also from an analog perspective, where those services need to be. Hence, actually, from the programme's perspective, actually have an equal kind of focus on the website as well, so that is, you know, more accessible to more. And then my final kind of thing for question for Matt, perhaps to explore. We've talked quite a lot on primary care this morning because that's been the initial focus. I wonder if you could just quickly, just in a nutshell, say where we are with other, you know, the plans for broader interaction with the wider health and care service.
Matt, we'll take Rowan and Ivan, and then you can pick up all those points at the point, any questions raised at the end. Rowan.
I unmuted this time, Chair. Matt, the other thing that I'd just liked for you to surface, perhaps Joanna's got something to say as well, which is, you know, the sort of stage 2 ambition to be able to, you know, prescribe digital services that are specific to the user. It also impacts on our sort of circular economy agenda, in that these could be originally developed by organisations outside of the NHS. For those organisations who are perhaps listening in today, can you talk about the timescales, approach, and sort of those sorts of considerations to enrich what we can offer?
And pick that, Ivan.
Diolch yn fawr, Cadeirydd. Wi jyst eisiau gwneud ambell sylw yn dilyn y cwestiynau a sylwadau gan bobl eraill. Gyntaf, wi eisiau nodi mor gyflym mae'r rhaglen yma wedi mynd dros dim ond tipyn bach yn fwy na blwyddyn sydd ers cychwyn y rhaglen yma. A mae'r cyflawniad yn yr amser yna yn rhywbeth i'w ganmol, wy'n ddiolchgar iawn i'r tîm. A hefyd, mae'r dull i ni'n defnyddio, sef y private beta, gweithio yn ddwys gyda defnyddwyr, cymryd adborth, a gweithio mas mewn camau sut i ni'n mynd i ledaenu defnydd o'r app. Hefyd yn weddol newydd i ni o ran darparu gwasanaethau digidol, a wy'n croesawu'r ymrwymiad hynny, a wy'n ddiolchgar i'r Llywodraeth yn gefnogi ni yn gwneud hynny o beth. O ran gymariaeth gyda Lloegr, does da ni ddim ffigurau am gost yr NHS app yn Lloegr, ond bues i yn rhan mawr o'r NHS COVID-19 app, sef y Proximity Tracking app. Oedd hwnna'n costi tua 45 miliwn y flwyddyn o ran datblygiad. Byddwch chi'n gweld y ffigurau am yn app ni nes ymlaen yn adroddiad Clare. Mae cryn dipyn yn llai na hynny. Ond y pwynt dwi eisiau gwneud yw, mi fydd yna lawer o bobl yn mynd yn gyffroes ynglyn â beth fedryd i wneud gyda'r app. Bydd bobl eisiau mwy o features, byddwn nhw eisiau mwy o wasanaethau trwy'r app, byddwn nhw eisiau ychwanegu pethau ar yr app. A mae rhaid i ni fod yn ofalus faint i ni'n rhoi ar yr app am ddau reswm. Un, bydd e'n cymlethu'r app, bydd e'n cymlethu'r profiad i ddefnyddwyr, a mae yna risg byddwn ni'n ceisio gwneud gormod, a mae rhaid i ni ffocysu ar gwneud rhai pethau yn dda iawn fel blaenoriaeth. Ac yn ail, mae pob peth ychwanegol yn mynd i costi mwy o arian, ac bod ni'n gwneud pethau yn fwy cynnil o lawer na beth sydd wedi cael ei wneud yn Lloegr am app cyffelyb. Serch hynny, does dim arian diben draw gyda ni na gyda'r Llywodraeth. Felly, mi fydd rhaid i ni fod a ffocws tyn iawn ynglyn â beth i ni'n ddilifro a beth i ni eisiau darparu trwy'r app. Ond dwi'n meddwl dim o hynny'n gymryd i ffwrdd o'r gwaith ardderchog sydd wedi'i wneud dros y flwyddyn diwetha. A mae 2023 mynd i fod yn flwyddyn gyffroes iawn i ni gyda'r app ar wefan sydd wedi cefn iddo fe.
Thank you, Ivan. Matt, and then obviously Joe, if you want to come in with any.
So I'll come back on the first questions, I think from Helen, in terms of what we're doing and who we're working with outside of primary care. And colleagues and people may not know that we've been working for some time with some Pathfinder projects within our local health board partners. So we're working with our local partners in Cardiff and Vale on a patient-reported outcome measure project, which we're seeking to integrate with the NHS Wales app, supporting citizens in how they manage and report changes in their condition. We're also working with colleagues from Swansea Bay insofar as a patient portal, which is important to them, which will be connected with the NHS Wales app. And the work with them has showed us how integration would work with other portals and other vendors. We've also been working with our colleagues in Ionawr and Bevan in a supported self-management project, which again, we're looking to have supporting them to have reach across Wales and for the benefit of that to be accelerated upwards. We're also working with a strategic planned care programme and looking to work in collaboration with them on waiting list information, how we could field that through the NHS Wales app as a first step, but also beyond that, looking at how we can build in self-management resources. So that as well as understanding where each of us as individuals might be on a waiting list, to understand what we can do to proactively manage our health and care whilst we're on that waiting list. So as kind of been referenced before, there's a hell of a lot planned. Our work has been very much focused on building the NHS Wales app and the core that will work. We've got so much possibility in terms of stepping outwards, but we've got to do that collaboratively to make sure that the resources which we've got available are well applied and deliver benefits which are going to count. So that answers that part. The second question I think we received was really about the stage 2, not just about the service users within Wales, but really about those potential vendors who would be very interested in perhaps plugging gaps and coming on board. So we ran a digital services patients and public symposium in November, which was very much focused on where we were with the NHS Wales app at the time and deployment. But we also provided an invitation to suppliers to understand more and to think about how we could work more collaboratively in the future. We've been developing a resource center concept, which the learning of integration will then be able to share, which we hope will reduce the costs of them wanting to work with us, and they'll at least understand the standards that it would take to be adopted into the NHS Wales app. So that's a very current theme of work, because we recognise that we're not going to do this on our own. We need to be working collaboratively to be able to achieve everything that we want to achieve into the future. I don't know if Joe wants to come in on anything on those points.
Yes, thanks, Matt. We've also been collating an alignment catalogue of resources that are used currently in Wales, and as you can imagine, there's pockets of good practice across Wales, and actually they're very similar, and there's a lot of duplication, so it's trying to pull that together. We've also been doing some work with Orca to develop an onboarding and accreditation process, so hopefully that will support people wanting to be part of what we're developing. And also, as Matt said, with the resource centre, that's a sort of a place for developers and professionals and the public to be able to find out all about the DSPP and the NHS Wales app. I just wonder if I could just go back quickly on one of the other questions that Marion had raised about digital poverty. One of the bits of work we're also doing with our Patients and Public Assurance group is developing digital inclusion questions that could be shared and standardised for the whole of Wales. And by using that information then to be able to point people in the locality to services that could support them. So again, working with Digital Communities Wales, they have nearly 900 people from public libraries to housing associations and other organisations that we can tap into and see other ways that we can try and encourage people to use the app, but also have the devices available for them to be able to use the app as well. So hopefully that 7% of the population will be able to use the app as well.
Thank you, Joe. Thank you, Matt. I did have a couple of questions, which I'll deal with some other time, just thinking on the basis of time. But if I perhaps just a couple of observations. First on that, as people will know, I mean, the whole issue around inclusivity and ensuring that we don't have an unintended consequence of exclusion is very dear to my heart. And in this and indeed all our programs, if we don't have that at the centre of our thinking and our work, then we will have seriously failed the population of the people of Wales. And I know, and Joe and I have had a number of conversations around this, that it is very central to your thinking and development of the app, and long may that continue. Second is the critical relationship with primary care, because the app will get blamed for things that can't be done on it, where the GP has actually just not turned on the functionality. And that was interesting in one of those bubble comments from the woman with an autistic child, who clearly thought it was the app's issue rather than obviously her GP practice hadn't turned on the functionality. So that is something I think we need to be mindful of, don't we, in terms of managing expectations and explaining expectations to people that might be different in different people from different practices. And third, and a really big takeaway for me, is, this is not here is the app, here's the done deal. This is an ongoing process, isn't it? And we all need to recognize that just as when you turn your phone on in the morning, your apps start revolving and updating, that's exactly what's going to be happening with this, isn't it, over time, based on feedback and more and more sophisticated and extensive operational stuff that can come into it. So it's not going to go away as a program ever, really. So and again, that's a conversation with the public, isn't it, about what expectation will be now and over time. So thank you very much indeed. I think I strongly suspect we could have gone on for another hour discussing this. It's our big first citizen-facing program, and many thanks to you and your teams for all the work you're doing, delivering in what is a very speedy timetable. So thank you, Matt. Thank you, Joe, for joining us, and no doubt we'll be hearing from you again in the future as more and more developments come on stream with the app. Thank you.
Thank you,
Joe. So if we move on now to the next item on the agenda, 4.1, my report. And as now is the practice, I just pick out three things I wanted to just draw your specific attention to in the report. And obviously, if there's anyone got any questions about any of the other issues, or indeed these issues, please do raise them. The first is the digital program governance review update. To give you an update on that, that is now Steve Coombe has delivered his final draft. It's with us and the Welsh Government for comment. And I'm hoping that we're going to be, I think the intention, Chris, is that we ought to be able to present that for the next public board meeting, in terms of putting the review into the public domain, and by then too some idea of where the recommendations or the observations in that report are being taken. So that is moving along. Just to point out, there's an update on our submission to the Health and Social Care and the Public Administration and Public Accounts Committee last year. You will see in my report there's a link to the follow-up information we gave to those committees on the basis of questions that they asked during the hearing and in a subsequent correspondence, which there's also a link to in my report. And no doubt we will now await correspondence from them if they want to pursue any particular issues that they ask for follow-up on. And finally, and a very happy task is to congratulate Marion and Rowan on their reappointment. They've been told, I haven't been told yet, but I'm sure I will be in due course. I think you've both had appointments to March 27, so 4-year appointments. So well done, and we are really pleased about that and look forward to your contribution to the work of the board over the next 4 years. Those are the 3 things that I specifically wanted to draw your attention to. Happy to take any questions on anything else if anyone wants anything further in terms of the issues raised in my report. If not, then we will go on to Helen's report. Item 4.2, Helen, over to you.
Thank you, Chair. Just a couple of things to highlight from me. Firstly, a big welcome to Sam Lloyd, who now completes my executive team. So yeah, big smile on my face for board meeting today to have the full team in place. And also a big welcome to the Lincoln RISP teams that have transferred over to us at the beginning of this month. So, and some great progress being made there. But also following that transfer, we've also, or the decision for that transfer, we've also been having conversations with the iCare digitisation programme, who are keen that DHCW, that programme also transfers over under kind of our statutory responsibilities. The programme's been with Cardiff and Vale for a number of years now, so we're in discussions with the SRO and Welsh Government around those arrangements. There's a gateway review scheduled for March, so that we understand the current state of the programme and what that would mean in terms of our ability to take it on. So I'll be updating the board further on that in due course. We also had our JET mid-year review on the 7th of December. Positive feedback from Welsh Government colleagues, good discussion. We talked about some of the achievements that we've made in the year and discussed some of the key challenges that we're facing, not least the challenges around long-term sustainable finance and what we need to do. So again, ongoing discussions with Claire and her team and myself and the newly appointed Chief Digital Officer. So Mike Emery came into post earlier this month. We've already had myself and the team a number of conversations, and it's clear that there's a huge desire to work in partnership to drive the digital agenda forward. So a key relationship for us in DHCW and actually for the wider system. And finally, from me, then a huge congratulations to the Welsh Nursing Care Record team. And it's not just DHCW, this is across Wales, a truly kind of national collaborative team approach there. They were awarded the Health and Social Care Judges Award at the recent MediWales event just before Christmas, and Rydia and I had the pleasure of joining them for the award ceremony. So well done to Claire Bevan and all of the team there, really proud of all of the work that they've done and a deserved accolade there. Happy to take any questions, Chair.
Thank you, Helen. Anyone got anything they'd like to raise? No? Okay, thank you very much, Helen. Received that report. And if we then move on to the next section of the agenda, the strategic items, part 5 and 5.1, and the strategic procurement report, and I'll invite Ivan Evans to introduce this item. And of course, we've been joined by Michelle. Good morning, Michelle. Ivan, over to you.
Diolch yn fawr, Cadeirydd. Wel, fel arfer, mae'n bleser mawr gyda fi I gyflwyno Michelle bydd yn arwennu trwy yr adroddiad a'r pwrcasu a caffael strategol.
Thanks, Ivan. Just before you start, Michelle, are we going to sort of probably the best stop after each one and then ask for approval?
Yep, we'll do.
Yep, great, lovely stuff.
Great, thank you, Chair Bwrdd. So there are 4 contracts in the papers that I'm presenting for the board's approval to award this morning. The first 3, they link together actually. They all relate to the library service. I think colleagues who were here will remember that Jessica Scorer came to the board in November and gave us a really good presentation in terms of the library that we provide across NHS Wales and the benefits of that. So it was I felt quite timely when I was looking at these, that hopefully colleagues can still remember that presentation. So part of that service is we provide online access to e-journals. There are 2 contracts in the set, and that's really because of the way in which we provision those services. So some of those agreements are direct with publishers, and that's the first contract, and some of those are provided to us through agents who in effect act on behalf of the publishers, to two separate agreements. So I will take the first one, which is for e-journals that we are contracting with the publishers directly. It provides access to 48 journals. The contract, you'll notice, is for a term of 1 year, and I think this links to the conversation that you had with Jessica in November. There's quite a lot of reviewing, actually, the materials that are provided. So there's a group that have regular reviews, and the specific journals that are being provisioned are subject to those reviews and confirmation that they are still required going forward. So we have a relatively short contract term because that enables us to change the mix should we wish to do so as we move forward into subsequent years. So that's why it's 12 months. The value of that one is about £1.2 million. The procurements, in fact, both of these procurements are procured under a framework agreement. So NICE, the National Institute for Health and Care Excellence, have helpfully put frameworks in place which allow us to call off these resources. And these frameworks are used in England as well to provide similar resources to them. So that gives us a really good framework. It gives us quite robust license terms that they've negotiated with the publishers. So that's our route to market. The contract, we have notified Welsh Government of our intention to enter into this contract as required. The Welsh Government have confirmed that notification, which means that the board is now in a position to make an award decision. And I should say the funding for these services is provided through our core allocation from Welsh Government. So we've confirmed through Claire and her team that we have the funding in place should we wish to execute this agreement. So I'm looking for the approval of the board to award that contract for e-journals.
Okay, and the question I was going to ask was about the annual issue, which you've addressed, Michelle. Any other questions? People happy to approve? Thank you. Next one, Michelle.
Thank you. So the next one, I touched on it a little bit. So this is the agreement that we have for those publications that are made available through agents, basically, and there are two there, EBSCO and Walters Kluwer, who we've been working with as agents to provision services for quite a long time, actually, in Wales. They have a good track record of delivery. Between the two of them, they will be delivering 68 e-journals across a wide range of users. Again, term of 1 year, same rationale as for the other e-journals. So it allows us to change the mix should we wish to do so. We use the same framework. License terms slightly different because we're operating through agents. So there's a sort of a middleman, if you like, in that position. So it's a slightly different set of terms and conditions, but also under the framework let by NICE. The value of this one, so it's just under £1 million, you'll note that. So we are not required to seek the notification and confirmation to Welsh Government, but we do, in accordance with standing orders, we do provide a summary, if you like, of all of the contracts that we've entered into of this kind of value to Welsh Government so that they're aware that this activity is taking place. So also presenting this agreement today for the approval of the board then to execute.
Thank you, Michelle. Any questions? People happy to approve? Yes, thank you, Michelle. Number 3.
I'm on a roll. So the number 3 is an agreement that we have with the Copyright Licensing Agency. So this is a mandatory requirement for us, really, and that we need to have this license in place to enable, again, a wide range of users across NHS Wales to be able to copy materials. And that's the online materials that we were just talking about in our e-library, and also in the physical libraries. Actually, it allows people. So this is really a legal requirement, and it's a service, again, that we offer for all of the health boards and trusts. There is only one provider who can provide this license to us, so we have to procure it as a single tender. And for that reason, we've actually gone for a longer term, actually, because we anticipate that this will be a continuing requirement moving forward. So we're proposing that this is a 5-year contract. The cost of that is around about 1.6 million. As I said, that's we're acting in our national capacity on this one. This one has been notified to Welsh Government of our intention to enter into a contract. We have not received confirmation of that notification from Welsh Government. I'm not raising this as a problem. I think that's a question of timing. So we anticipate that would be the case, but I am presenting it therefore for the approval of the board, subject to that confirmation from Welsh Government, and we would expect to confirm that to the chair before we took action to execute the agreement.
Thank you. Any questions or comments on this one? I've got lots, but I won't. It's fascinating, this one, isn't it? It's the way that copyright works and how the money's distributed. People happy to approve it? Thank you, Michelle. And then the last one.
Okay, so the fourth contract, slightly different area, this one. So this is in relation to the Microsoft Teams voice capabilities. So again, we awarded an agreement to Microsoft now back in the kind of May time for licenses, which provided access to a range of Microsoft services, one of which is the Teams voice capability. This procurement, therefore, is to enable us to deploy and use some of those licenses in terms of the contact centre specifically. So in Digital Health and Care Wales, we anticipate using this service to support our service desk and our service desk users. So the contract we're proposing is awarded to Softcat. It was procured through a framework procurement. Because of the nature of the requirement, we reached out to our Health Board and Trust colleagues to ask if they wanted to collaborate with us on this. Claire's nodding. I think Claire helped to facilitate that. Actually, it was an offer if others wanted to take this up to work collectively. Two parties you can see in the papers did decide to participate. So the Health Board and the NHS Wales Shared Services, who are actually hosted by Valindra. Their requirement, again, you can see from the paper, is slightly more extensive than ours. They've got a range of services that they are planning to support, including some of their primary care, accounts payable, etc. So it's a slightly wider requirement or benefit for them. So the total value that you will see on the paper is for 1.6 million. That's not our anticipated expenditure. So in the detail, you can see that's the total for all three parties. Our maximum expenditure that we anticipate is around about 500,000. There are some options under that. You can see the options really relate to us being able to call off additional licenses if we wanted to add servers or users from our perspective during the term of the agreement. Our intention to enter into this contract has been notified to Welsh Government, and Welsh Government have confirmed that they understand that we are proposing to do so. So subject to the approval of the board today, we can move forward to award this contract.
Okay, thank you. I've got question or comment from Alistair and David, and they may well be about to ask what I would have asked. So Alistair and then David.
Thank you, Chair. Actually, Michelle, it's not just relating to this one, but those that we've already looked at. It's just for verification that this expenditure and the others are from planned expenditure and within broadly our budgets as set out, and they're not in any way in excess of our planned expenditure, or if they are, that we have adjusted our plans to meet them. It's really just for that confirmation. Thank you.
Michelle, do you pick that up now?
Yep, thanks, Alistair. Really good point. So there's a really brief note in the paper that we put that out, but all of these are within our current budget allocations, so it would have been planned. Claire may want to add to that. Again, she was nodding. So that is my understanding, that these are all in the plan for this year, and they've all been accounted for within our core budget allocation.
Claire, anything you want to add?
No, Michelle's totally correct.
Okay.
They are within budget. Yeah.
Thank you. David.
Thanks, Simon. Thanks, Michelle, for the briefing. Two questions, if I may. So the first one is this capability is going to replace an old Mitel system that we're currently using. Are there any cost savings that we will get as a result of decommissioning that? And is that in addition to, or that you're taking those savings into account in terms of the number you presented?
So that's a very good question. I was looking at Claire. I don't know if Claire's aware of that. So the cost presented in the paper is the cost to execute this contract. So it's not taking account of any savings. You're absolutely right. This is a transition project which allows us to move away from the kind of on-premise Mitel solution to a cloud-based solution. Claire, I don't know if you've got any detail in terms of savings specifically.
Yeah, I don't have the numbers to hand, but there is some benefit from moving to this system, and it's netted off. So the net effect is neutral, but it has been netted off to enable us to afford this. Yes.
Thanks. That's really good. And the second question is, a couple of health boards have taken the option to join us. I don't know the duration of this, but is there an option in the contract if any of the health boards that haven't joined at this point want to join at some point in the near future?
No. Before you go, Michelle, I'll add my little bit, because that's very much in the sort of the same you may or may not be able to do this, but are there interesting reasons why they did and they didn't that might inform how we did things in the future?
Yeah, so two good points. To David's question first, no, this is a specific award for those three parties. And one of the reasons for that will be because we've procured under a framework. So, you know, so if we're using a framework as our procurement vehicle, then we need to be specific about the services that we anticipate calling off. So as I understand it, all of the health boards and trusts were party to the conversations. They all had the opportunity to include their requirements, and those three parties have decided to participate. Again, Simon, I wasn't involved in the process, but that is a good point, and I will follow up on that point about any lessons learned in terms of participation. I anticipate the most likely response on that would be that those were the parties who wanted to proceed with this particular service, and you know, we're at the point where they're able to do that, and also to fund it, obviously. So it was likely a reflection of existing contracts. But I noticed Claire's got a hand up. You were more closely involved. Claire, you may want to comment.
Yeah, so I think timing has got a lot to play in this,
right.
And we did, together with the directors of Digital Peer Group, work to establish who would be interested. I think it's really got to do with the timing around the need, the necessity, certainly for ourselves, but also for shared services to undertake the work that we needed to do, which is why no further other health boards came on board at this point.
So there's a potentially interesting lesson about how you land timings to coincide if there is potential benefit from going with multiple organizations. Okay, any other questions or comments? No. Happy to approve this contract? Yes, by the looks of it. Thank you very much, and thank you, Michelle, as ever, for presenting the strategic procurement report. And we've moved then on to item 5.2, which is the IMTP 23-26 update, and even ask you to introduce.
Diolch yn fawr iawn, Cadeirydd. Wel, diolch I chi a Helen a Michelle i ni o flaen yn amserlen hefyd. Falle bydd na fydd yr eitem yma yn cymryd ni lant yn ganol dydd. So, just rhag ofn bod na rhywbeth arall rydyn ni'n gwneud hwnna. Dwi eisiau just tynnu sylw at yr adroddiad I hun y canolbwyntio ar adran 3 ac adran 4 yn y papur clawr sydd yma. Bydd aelodau'n gyfarwydd gyda sut I ni'n mynd o'i chwmpas I o ran datblygu yr IMTP ar gyfer blwyddyn nesaf yn dilyn y gweithdy a gafwyd just cyn y Nadolig, lle oedd yr aelodau I gyd yn bresennol a wedi cyfrannu at y broses hynna. Be wi eisiau pwysleisio mwy na dim yw bod yna lawer iawn o waith dwys yn digwydd ar hyn o bryd. Fedrwch chi weld amserlen yn adran 3 fel sort of timeline, a hefyd I ni'n tynnu allan nifer o bethau I ni'n gwneud gweithdai, gweithio gyda rhanddeiliad, a adolygu'r cynlluniau a phethau tebyg, a mae hynna'n waith ar draws y sefydliad I gyd. Un peth sy'n I ni'n rhoi pwyslais arbennig ar eleni yw y senarios ariannol. Fel byddwch chi'n gweld o adroddiad Claire nes ymlaen yn y cyfarfod, mae'r sefyllfa ariannol, a byddwch chi'n siŵr yn ymwybodol, mae'r sefyllfa ariannol ar draws yr NHS yn un anodd iawn ar hyn o bryd, felly ni'n edrych yn ofalus iawn ar yr adnoddau sydd gyda ni, yr arian a'r pobl I ddilifro mwyn ceisio sicrhau bod gyda ni beth sydd angen yn y cynllun ar gyfer y flwyddyn. A'r ail beth byddwn ni'n tynnu sylw at yn arbennig yw bod ni'n ceisio addasu ein cynllun ni fel bod e'n aleinio yn fwy clir gyda blaenoriaethau Llywodraeth a gyda rhaglenni strategol cenedlaethol. A ni'n gwneud hynny ar lefel portffolio, mwy na dim byd arall, felly mi fydd yr IMTP yn edrych yn gyfarwydd o ran y fformat yn gyffredinol, ond mi fydd hi'n haws darllen ar draws o y portfolios sydd yn ein IMTP ni yn erbyn y blaenoriaethau mae'r gweinidog wedi rhoi i'r NHS yn ei gyfanrwydd. Gan bod tipyn bach mwy o amser, wi jyst eisiau sôn am penawd 4, sef, mae'n cael ei ddisgrifio fel risgiau allweddol a materion yw codi a sylw y bwrdd. Maen nhw yna gwybodaeth, maen nhw gyd yn ymwneud â'r sefyllfa ariannol a sut I ni'n edrych ar ein sefyllfa ariannol wrth gwrs yr IMTP. Dwi ddim yn codi nhw fan hyn i'r bwrdd mwyn i'r bwrdd neu penderfyniadau yn eu cylch nhw. Mae llawer ohonyn nhw. A mae'n bethau sydd yn ymwneud â sefyllfa ar hinsawdd i ni'n gweithredio i mewn hi, ond wy'n codi nhw gwybodaeth. A i gloi, wi jyst eisiau rhoi blas ar beth dwi'n meddwl bydd yn nodweddu ar IMTP eleni sydd tipyn bach yn wahanol i'r un cynt. O edrych yn strategol ar lle mae'r IMTP yn mynd, wy'n credu bod ni'n gwthio yn fwy pendant mewn i, wel, ni'n gwthio'n fwy pendant allan o ysbytau a gofal yn y setting ysbyty. Chi wedi cael cyflwyniad ar app DSPP. Sam Hall wedi effynodi fel cyfarwyddwraig gofal cychwynnol a cymunedol a iechyd a meddwl. Mae rheina'n feisydd lle ni'n gwthio mewn i'r ardal hynny yn fwy penderfynol falle na i ni wedi gwneud o'r blaen. Felly, yn strategol, dwi'n meddwl bod hwnna'n thema o newid, welwch chi yn yr IMTP. Ac yn ail, mae gyda ni, mae'n mynd i fod yn flwyddyn bwysig i lawer iawn o'n cynlluniau, o'n prif cynlluniau. Byddwch chi'n ymwybodol bod ni wedi cael cyfrifoldebau newydd oddi wrth y Llywodraeth arian ychwanegol trwy'r DPIF llynedd a'r flwyddyn gynt o ran Covid. A mae 2023 yn blwyddyn bwysig iawn i'r rhaglen DSPP, i'r rhaglen y National Data Resource, i'r rhaglen Digital Medicines Transformation Programme, a mae yna lawer o bethau mawr i ni i ddilifro yn ystod blwyddyn. Felly mae'n mynd i fod yn blwyddyn bwysig iawn, a fyddwch chi'n gweld hynny'n dod trwy yn y cynllun. Mi fyddwn ni yn trafod y cynllun dros yr wythnosau nesaf, a wedyn bydd e'n dod nôl i'r cyfarfod cyhoeddus am mis Mawrth ar gyfer Steddfod ffurfiol.
Thank you, Ivan. I very much hope you don't take us through till midday, otherwise you'll have deprived everyone of the break, which we have from the end of this item up till midday.
I misread, sorry.
Alistair first and then Ruth.
So I'll keep it brief then, Chair. Ivan, thank you for that. It's a very uncertain period, but I just wanted to address in terms of the key risks, the heightened level of security concerns at an international level. Have we reassessed, or did we need to reassess further the risk of cyber attacks from what we now see to be a very significantly developing security problem within Europe, and the potential for that to turn into yet more and very much more aggressive cyber attacks from those who are the sort of parties that we can anticipate. And I just wondered if you could comment on that, Ivan.
Yeah, I'll do that briefly. I'll respond in the language that people are asking questions of me. Sam Lloyd may want to come in. Yes, we're being as vigilant as we can possibly be. You'll recall that we looked at the cyber strategy in our recent meeting. We've also enhanced our cyber protection arrangements through the Microsoft Enterprise contract. So we've dialed up on some of the cyber elements there. And yesterday, and I was going to mention this as we come to the board champion report, yesterday we took around 60 people, senior, our gold, silver and bronze, everyone who participates in our gold, silver and bronze, and we had a full day exercise where we looked through a cyber situation scenario, quite reminiscent of the experience in Ireland not long ago, which again has been presented to the board and has been presented to independent members actually across NHS Wales. So we are being as vigilant as we can be, but there's no room at all for any sort of complacency. But you'll see that coming through in the IMTP.
Sammy, by all means, Sam Lloyd, if you want to add anything, please do.
Thank you, Chair. Yeah, just to add briefly that there is a cyber plan that we have developed, and there is the funding case to deliver that, which is coming to the private session later. So we do have a plan for the continued strengthening of our cyber posture. Thank you.
Thank you, Sam. Ruth and then Rowan.
Thanks, Chair. Thanks, Ivan. I guess I just wanted to explore the point a little bit more around risk and the financial risk, because the financial risk isn't just ours, is it, this year? As the health boards get their settlements, and we identified where we think they're going to be contracting this year and what impact that will have on our delivery ability, because obviously we can't deliver anything in isolation, and if the health boards are reducing resource across things which might help us deliver digital programs, then we have to identify that as a risk. That will be what prevents us from delivering our IMTP.
There's huge risk there, isn't there? Are you going to cover that even, and then I'll bring Claire in probably?
Yeah, I'm going to bring Claire in if that's okay.
Yeah.
So I'm leading, Ruth, I'm leading the close engagement with the directors of planning peer group to make sure that we're aligned from a planning perspective. I know Claire is working, and the directors of finance peer group is working very, very intensively at the moment. And actually, they met in our offices last Friday. So I'll ask Claire to just respond on that.
Yeah, thank you, and thank you, Ruth. It is one of the hardest financial environments I think we're going to have to embrace over the next 12 months in order for all of us as a system to balance, but also as DHCW to balance. So yes, as you know, we've got many funding streams, one of which is related to the health boards and trusts. So we're working alongside them for them to understand and appreciate those values and where they come from. And I think there's general consensus around that what we've presented is fair and transparent, but it calls into question their affordability in order to meet that obligation. So that's one side of it. The other side is we're part of a system. So as a collective NHS digital ecosystem, we also have to work with the directors of digital peer group to understand how we prioritise the best fit between us on how we allocate and use our resources over this period of time. So there is quite a lot of work that we're doing as a collective, really, to understand the choices that we're going to have to make between now and the end of March in order for us all to deliver a balanced budget. So it is challenging, it is hard, and we're working alongside each other really to make the right decisions and the right choices. And we're working on that. We're not there yet. We're working on that.
No, and if you recall, the part of the government response to our IMTP, this year's IMTP, was to go off and seek resources from health boards to replace non-recurrent resources from the Welsh Government, which makes it doubly more difficult, doesn't it, in terms of the current financial environment. Rowan, I did see your hand up, but it's disappeared. Did you want to come in?
I think we've touched on some of the thoughts I was going to ask about, so I don't need to hear my voice again.
Okay, thank you, Rowan. Ivan, anything you wanted to add in conclusion? You can go until 12. We won't necessarily be here.
No. Having been corrected on the agenda, Simon, I'm more than happy for you to wrap up the item now.
Okay, well, thank you very much for that update, Ivan. And obviously, as you say, in the March meeting, we'll have a longer agenda item where we're considering for sign off the IMTP for 23 to 26. So thank you for that. So now, what time is it? It's now 11:27. So we have a half-hour break until midday. If people could remember to turn their cameras and their microphones off, and we'll rejoin just a few moments before midday. Thank you all very much. If people could turn their cameras on so I know who's back in. I can see you're back with us, Rowan, Claire and Ruth. Okay, sorry, it had defaulted back to a different view, so I could only see 4 of you, but so it looks like everyone is back. Great. So welcome back, everyone, to the next part of the agenda, moving on to part 6 of the agenda. And as people will recall and know, we have a number of board champion roles that are, I think they're actually set out in legislation, the requirements to have them. And some of those are to a greater or lesser extent relevant to the work of and role of DHCW. But what we thought we'd do was we'd bring an annual review of the work and activity of those board champions together in one report, which is what we're taking now. And I'll ask Chris to introduce the item. Thank you, Chris.
Thanks, Chair. Yeah, I'm just pleased to present the first update to the board of our board champion work. I'm just going to quickly run through and give a bit of background around board champions for those that are new to the board. So our standing orders state that the chair will ensure that individual board members are assigned with lead or champion roles as required by Welsh ministers or set out in statutory guidance. So for us, the statutory guidance is via a Welsh Health Circular. The most recent issue was in January 2021 that confirmed a number of rationalised board champion roles. Previously, there was a much longer list of board champion roles. That has been reduced, but it should be noted since that guidance, there was additional request for the role of a board champion for research to be added onto the list. So that has subsequently been included as a non-executive member board champion role. The board champion roles have been in place in health boards and trusts since 2003. It's fair to say that a number of the roles, as you alluded to, Simon, don't relate to DHCW in the same way they do to health boards and trusts, but nonetheless, as an organisation, we have assigned board champion roles throughout the entire list of that identified through the statutory guidance. We are asking today for the board to receive the first update in terms of the work that's been undertaking, so that the report, which is included as Appendix A, covers a summary of the national activity, some of the local work, and then some of the forward planned work in each of the board champion areas. And there's a link to the paper that came to the board in May 2022, agreeing board champion roles and allocation. So I'm asking the board to receive and note the work today, and inviting any board champions who want to highlight anything specifically from the work that has been undertaken, or some of the future work plan that will come back to the board. If they want to come in, happy that they do so now, and then happy to take any questions.
Thank you, Chris. And the way in which the report is set out is really helpful and very clear. I've got Sarah Jane wants to come in. Sarah Jane.
Thank you, Chair. Just to say, we've been quite busy in our area in terms of the equality and diversity arena, violence and aggression, and the veterans. But just to sort of highlight to the board that the equality strategic plan is currently in development. It goes out for consultation today. And a big thanks to Marilyn, actually, as our critical friend in this regard. She's been absolutely fantastic. So I think it's actually broadened our horizons in terms of some of the external engagement that we can do as well, which is really great. So just to say that will be coming to the board in March. So looking forward to presenting that and taking that forward with the commitments underneath it.
Thank you, Sarah Jane. Does anyone else wish to comment or? No. So thank you very much, Chris. We're asked to receive that report, this report, and obviously this will be an annual item that we'll be taking in the future. on the activity and the work of the board champions. Thank you. If we move on then to item 6.2, the integrated organizational performance report, and I'll ask Ivan as Executive Director of Strategy to introduce the item. Over to you, Ivan.
Diolch yn fawr iawn, Cadeirydd. Mae hwn yn adroddiad eitha sylweddol, cryn dipyn o wybodaeth yn yr adroddiad perfformiad sefydliadol integredig. Mi fydd aelodau yn weddol gyfarwydd, wy'n siŵr, gyda strwythur y ddogfen, mi fyddai'n gwahodd cwestiynau oddi wrthoch chi yn erbyn y portfolios a'r themau sydd yn y ddogfen mewn munud, ond mae'n jyst gyflwyno o'r papur clawr ambell i beth yn gyntaf. Felly, yn gyntaf, mae'r adroddiad i'r cyfarfod yma yn cynnwys y portfolios manwl sydd yn yr IMTP. 12 portfolio, mae yna dudalen yn erbyn bob un o rheini yn adrodd ar delivery a perfformiad yn ei erbyn nhw. I ni'n ceisio, fel ych chi'n gwybod, dod â cysondeb rhwng yr IMTP a'r IOPR fel bod ni'n gallu gweld sgerbwd clir neu fframwaith clir trwy'r gweithgaredd sydd gyda ni o ran beth ni'n cynllunio a wedyn sut ni'n adrodd ar berfformiad. Mi nes i ddweud yn y cyflwyniad ar yr IMTP yn yr eitem just cynllunio bod e'n gyfnod prysur iawn o ran cynllunio ar gyfer y flwyddyn nesaf, neu dair blwyddyn nesaf. Mae hefyd yn gyfnod prysur iawn o ran perfformiad ar hyn o bryd i ni mewn i'r chwarter olaf y flwyddyn. Felly, jyst i roi ambell enghraifft i chi, y mis Rhagfyr, wnaethon ni adolygiad o'r prif raglenni, a mae yna rhywfaint o drafod wedi bod gyda'r Llywodraeth ynglŷn â symud blaenoriaethau o un i'r llall. Mi fydd adnoddau hynny yw, arian cyllid, mi fydd Claire yn sôn am hwnna yn yr adroddiad cyllid sydd yn dilyn. I ni dros yr wythnosau nesaf yn gwneud directorate reviews o bob un o'r cyfarwyddiaethau sydd i gael yn y sefydliad. Helen yn gadeiro'r gwaith hynny, a wedyn yn ystod mis Chwefror, mi fyddwn ni'n gwneud adolygiad o'r portfolio sydd gyda ni ar rhaglenni, jyst er mwyn wneud yn siŵr bod y perfformiad yn iawn wrth bod ni'n mynd mewn i y 2 fis olaf yn y flwyddyn. Felly, mae yna lot fawr o sylw yn hynny sydd tu cefn i'r adroddiad, mae fe yn waith mwy rheoliadol. Felly, byddai'n gwahodd cwestiynau ar y portfolios a wedyn byddai'n gwahodd cydweithio mewn i cyd-aelodau mewn i ateb yn erbyn rheina wrth i ni fynd. Mae yna plan on a page, mae cynllun ar un tudalen. Mae yna ddau fesur fyna sy'n cael ei adnabod yn goch. Byddwch chi'n cofio'r trafodaeth gaethon ni yn yr Hydref. Dydy hynna ddim yn rag rating risg. Mae nhw'n cael ei adnabod yn goch os nad ydyn nhw wedi cael ei dilifro yn erbyn yr amserlen. Felly, os oes yna gwestiynau ar rheini, byddai'n gwahodd rhyddian mewn ar yr un gwybodaeth a Sam Hall ar WCCIS. A wi jyst eisiau nodi un camgymeriad sydd yn y ddogfen, sef yn y plan on a page, mae'r WCCIS Strategic Roadmap yn goch, ond yn y portfolio mae'n dangos yn wyrdd. Coch sydd yn gywir, y plan on a page sydd yn gywir, dyw e ddim wedi cael ei gwblhau eto, a bydd Sam yn rhoi manylion ar hynny, os oes angen. A wedyn, os oes cwestiynau ar is-adeiledd, ar Cyber, fel i ni wedi trafod yn hynt heddiw, neu ar yr adroddiadau cynnal gwasanaethau, mi fydd Sam Lloyd yn gallu adrodd ar hwnnw. Mae yna un mesur newydd, sef availability, neu uptime, lle ni'n adrodd ar y lefel, neu cyfanswm yr amser mae ein gwasanaethau ar gael ar draws Cymru, er mwyn dangos beth yw'r cyswllt ar gyfer y major IT incidents. A falle bydd Sam yn sôn am y major IT incidents a saith ohonyn nhw sydd yn yr adroddiad. Ac eto, bydd aelodau'n cofio i ni gael sgwrs ym mis Medi, dwi'n meddwl, ynglŷn â sut mae'n terminoleg ni yn wahanol i terminoleg ar NHS. Felly mae major IT incident ddim yr un peth a major incident yn yr NHS. Mae nhw'n bethau gwahanol iawn. A oedd hynna'n un o'r bethau wnaethon ni drafod yn yr ymarfer wnaethon ni wneud ddoi fel o ran business continuity a cyber security. Felly, mae yna bethau sydd wedi cael ei amlygu yn y papur clawr, cyber, cancer, digital services for public and patients, WEDS, information governance. Ond mi fydd cyfle i ni godi rhain wrth bod ni'n mynd trwy'r adroddiad os oes yna unrhyw gwestiynau. Felly, fi'n credu, Simon, os allai handio nôl i chi er mwyn arwennu trwy'r adroddiad, a wedyn mi fydda i a cyfarwyddwyr eraill yn gallu ateb yn erbyn adrannau o'r IOPR wrth bod ni'n mynd trwy.
Right, so I mean, essentially you're asking, has anyone got any particular overarching questions? And then I'll go back to you, Ivan, and then you can just call people in so David, you have.
Thanks, Simon. Thanks, Ivan. So in terms of the two items on the plan on the page that are red, I understand what you said about them being red because they weren't delivered within the allotted timescale. Can you just update, or maybe Iridian could update us in terms of the information security? Is that one still outstanding, or has it been delivered? And if it's not been delivered, what's the plan to deliver it? And also on the Welsh Community Care Information System, again, same question. Has it now been completed, or if not, what's the date for target completion?
Did you want to bring Iridian in on the first and Sam Hall on the
Yeah,
second?
so thank you, David. So the first is on is Welsh Government develop and promote a Welsh Government information governance framework. So to an extent, that is in the hands of Welsh Government, although we have an ongoing dialogue with them. I'll ask Iridian as lead for information governance whether there's anything that he's able to update on that first, and then I'll come to Sam on Welsh Community Care Information System.
You're on mute, Iridian.
Thanks, Stephen. A couple of things to say there. Darren Lloyd, who heads up this element of the portfolio that I hold, is working closely with Welsh Government colleagues on a number of strategic outline plans for the governance framework, which is divided into sections, including things such as Welsh Accord for sharing of personal information. The appointment of the CDO is key in this, and of course, as you know, he just arrived in January. I dare say his desk is weighted down with some tricky problems. This is one of them in terms of getting it over the line, and I should be able to have an update with some more definitive timelines once we've had an opportunity to get to work out the detail with him.
Okay, before Sam comes in, I presume, Rowan, you want to pick up on this point?
Yeah, I just wanted to comment that this is a topic that is regularly discussed in the Digital and Governance Safety Committee, and I would reflect that our relationship with Welsh Government and the support of that we're providing is a really good working relationship. And I also think that information governance always has to be right, and it has to be fit for purpose, and it's still a conversation. So information governance is not the same as information security. So I just want to make sure that people are not concerned that there is there is something amiss in that respect.
Good point. Thank you, Rowan. And then you wanted to bring Sam in on WCCIS, yes?
Yes, please.
Hi, Sam.
Hi, thank you. Just to confirm, David, yes, we haven't delivered the long-term roadmap yet. And whilst it's not ideal, I feel that the reasons behind the delay are sound, and it makes sense to do all we can to fully understand what will be required for the future. We were keen to identify what was important for our stakeholders in the longer term. So as part of the strategic review that's been going on now for the past couple of months, we made much more time for stakeholder engagement, as we felt that was incredibly important for those already on the journey with us, but also the other organisations that hadn't joined. And so we spent a lot of time, done a lot of engagement, and having seen some of the early work from the review, it's identified some very clear drivers for us for the future that we will want to work through and refine into our detailed plans. For instance, some of the things coming through are things around interoperability with other systems and clear sets of standards. So really, really helpful things that will help us to understand that roadmap for the future. But just to answer your point around when will we get something? The review is just coming to its end, and so the work to produce the roadmap will be completed by the end of this quarter.
Thank you, Sam. Anyone else before I ask Ivan to? Okay, back to you, Ivan. You'll bring in the individuals then now. Is that what you that was your intention?
Yeah,
wasn't it?
well, so yes, I was inviting general questions on the 12 portfolios that are in the first half of the report, and then we move into the regular structure.
Yeah.
I wasn't intending to go through each individual slide and to call out somebody to speak to the slides. I was just going to invite, leave it, because everybody's had the opportunity to read the report, and it's a fairly familiar report. So I just wanted to give the opportunity, really. If there's anything that Sam wants to come in on the service and the infrastructure, then you're very welcome to do that. And I've discussed previously with Claire. Claire's finance report follows immediately afterwards. So my suggestion would be that we don't dig into the finance section here. We can do that through Claire's finance report. Okay, so Sam Lloyd.
Thank you, Chair. Just to ask the board to note a couple of points from the report. From a major incidents perspective, we had 12 over the 2-month reporting period, 5 in November and 7 in December, which is towards the higher end of what we've historically seen. But so we'll keep an eye on that for any trending. But they were all resolved within the SLAs. There's a range of root causes across those major incidents, and we do refer to the incident review and learning group as appropriate to make sure that we pick up any learnings. There were 2 on WPAS which had a common cause, which were related to Citrix, and those have now been resolved. The root cause has been fixed. As Ivan mentioned, we do have a new service availability indicator. The numbers are in the report. I won't go through them, but I think it's important to note there's a graph in there which shows that there were fairly significant improvements in availability made during the previous financial year, and those have been sustained over the course of the current financial year, which is evidence of our ongoing strengthening of resilience and infrastructure. Thank you.
Thank you, Sam. Any comments or questions? And anyone else want to comment on any of the specifics? Helen, and then Rowan.
And thanks, Ivan and Sam's for the updates. I just wanted to say how pleased I am to see the availability indicator now included within the performance report. I think that's a really helpful measure, and is one that is, it gives us, it's almost the litmus test, isn't it, in terms of wider organisation kind of work that we're doing. So just really pleased to see that at the forefront now of the performance report.
Thank you, Helen. Rowan.
It's just a request, really, if we might report that information against the previous year. I think that will help the board and people reading these reports understand the value of the investments being made, and I think that would be helpful. So it's just a comment, really.
That's the service availability data.
Yeah, and the major incidents.
Yeah, because we've got the service availability we've got the 2 years, if I'm looking at the right thing, which is on page 25. And the interesting thing is, not only is it the trend better, but there are far fewer peaks and troughs, aren't there? It's a much flatter line. So okay, and then you wanted the year-on-year comparison on the
service incidents.
Yeah. Okay, and I presume that's achievable.
I will take that away and investigate.
Have a look at it. Okay.
So. Yep. Thank you.
Thank you. Any other comments on the report, Marion?
Diolch, Cadeirydd. Dim ond sylw yn ytrach na cwestiwn wir. Wrth i ni wynebu chwarter ola'r flwyddyn ariannol yma, dyma'r ail flwyddyn i ni'n bodoli fel sefydliad wrth gwrs. Gai jyst dweud pa mor braf ydi gweld yr adroddiad wedi esblygu yn y ffordd mae o. Mae wedi cryfhau, mae wedi ehangu i orwelion, ond mae hefyd yn arbennig o braf gyda'r ddau eithriad falle y cyfeiriodd Ifan atyn nhw sydd yn amlwg yn y coch. Ond yn gyffredinol mae'r perfformiad yn galonogol iawn, ac so ni jyst yn licio manteisio ar y cyfle yma i ddiolch i'r tîm am y cynnydd dyn ni wedi weld, ac bydd yn braf edrych nôl ar y flwyddyn gyfan yma unwaith y byddwn ni wedi cwblhau'r tymor. Diolch yn fawr.
Thanks, Marion. I'm sure people would echo that thought. Okay, if there isn't anything else, Ivan, I think that people are happy to receive the performance report, and we'll move on to, as you've mentioned, onto the finance report, and I'll invite Claire, Executive Director of Finance, to present the report. Over to you, Claire.
Diolch, Simon.
Are you sharing slides, Claire, or?
I am, with the aid from Hannah, I think. if that's possible. So, Pranam Dar, good afternoon. I'm going to talk you through the financial performance of DHCW as at the end of the calendar year, December 31st, 2022. So I'm going to take you through the slides and I will cover the key areas really, which is, if you move on to the next slide, Hannah, is really to summarise our performance from two lenses. One is the revenue lens, so how we're performing in terms of our run rates, but also in terms of some of our key deliverables, savings, in particular COVID and the development aspects, the digital priorities investment funds. The other lens we look through is the capital investment programme, and again we'll take you through our performance there and the outlook for Q4. I will highlight some of the risks and opportunities that we currently are presenting with. And then finally, I will focus a bit on next year and the financial challenges and influences we have on our planning process that we've already touched upon, but I will go in a bit more detail. So if we move on to the next slide. As you know, as an organisation, we have some statutory responsibilities, but I tend to slice the organisation into three key areas of activity. The first relates to our core ongoing activities, which is directly funded from Welsh Government and our NHS organisations. The COVID response is a separate funding stream, but I'll show you our progress there and activity to date. And then we'll look at our development, which is primarily through the DPIF, the Digital Priorities Investment Funds, and where we are in terms of our programmes and our outlook for the last quarter. So if we move on to the next slide. This table summarises really our statutory responsibilities as a board. So this table shows you where we are at the end of December, but it also gives you the outlook, and it looks remarkably green. So in each of those areas, we have a responsibility to remain within our revenue and capital limits. As you can see, at the end of December, we were 462,000 underspent, slight movement on the previous month. And our forward projection is that we will balance our books at the end of this financial year. Capital spend at the end of the year was just shy of 4.4 million against an allocation for the year of 8 million. There was a slight underspend in the month, but actually we're on track, and I'll show you the forward projection of that, which is quite significant in the last quarter. We achieved our public sector payment policy. Target there is 95, we achieved 98. And we had an increase in our cash inflow into the month, so our cash actually increased by 3.7 million. But obviously, we've got a target to get that in within the target of 2 million by the year end. There are two other points of note for the board. We actually received the pay award increase from Welsh Government, which will now form part of our recurrent funding of 1.8 million. And as you're aware, there were exceptional costs that Welsh Government agreed to fund this year. Energy was one of those. This year, we will be able to subsume that cost for ourselves, but the outlook is challenging, and I'll come on to that later. We're looking at £1 million potentially of inflationary pressures within energy, particularly around our data centres on our estates. So I'll touch on that in a bit. So if we move on to the next slide, Hannah. Okay, this chart really illustrates from a pay and non-pay perspective on a monthly basis, our run rates, our spend profiles. Year to date, we've just spent shy of £104 million, and those are the ones highlighted in red. And we're forecast to spend a further 44 million in the final quarter of the year. And again, you'll see there is actually quite a kick up in spend in the last quarter. The main variations in spend relate primarily to our digital spend, our development spend, sorry, from the Digital Priorities Investment Funds. And particularly towards the end of the year, you can see a significant amount of spend related to work packages, primarily within our top 4 programmes, which I'll show you a bit later in the slides. But that's really the reason for the main variation in spend. We move on to the next slide, please. From an organisational perspective, this chart highlights where the directorate allocations of budgets are under or over in terms of their spend profile. This is a very similar picture, and it has been throughout the year in terms of the underspend. It's spread across most directorates, excluding ICT, which is Information Communications Technology Directorate, And it really reflects the vacancy position across those directorates. However, there is within the clinical directorate a slight underspend relating to e-libraries, and that's really a phasing impact. But other than that, it's really a reflection of the recruitment requirement. Within ICT, we do see a cost pressure, and that really reflects resourcing. So we have undertaken an activity in Q3 to do an independent benchmarking exercise, looking at resources, which will really try and understand and target strategically what resourcing requirement is needed in the area and what that would mean for next year in terms of funding requirement. So that's really where we are at the end of December at a 462 underspend. If we move on to the next slide, please. In relation to our savings plan, we had a target of 2.5 million this year, and out of that target, I know Sam will be interested in this, we expect to recover 1.1 recurrently in savings for this financial year. We have actually overshot our savings target for this year, again reflecting the pay efficiencies in relating to our recruitment. And in the last quarter, we've identified further opportunities for savings, primarily around travel and expenses, which we've highlighted in our monthly monitoring returns to Welsh Government. So if we move on to the next slide. COVID funding and activity remains high. So we have two areas of spend. In total, we've spent 7.5 million with an annual budget just shy of 10 million. That should say December and October, apologies. From a test, track and protect perspective, we've seen activity fall away towards the back end of the year. And we've reassessed the licensing numbers. And obviously we are also looking at that in light of the requirement for the forthcoming year. In terms of COVID vaccine, we did have a peak in activity between October and November, and that's fallen away in December. And you can see the impact of that spend run rate has really been influenced by the letters and volumes in the graph underneath. So overall, we're in line with plan, and these are all reflected in our Welsh Government returns. So next slide, please. The other key area of activity is obviously within the digital development arena. This graph demonstrates what we spent and what residual is to spend across each of the schemes, from the largest to the smallest. And as you can see from the presentation that you had this earlier on, the digital services from patient and public is over a 5.6 million spend this year in terms of the programme itself. So to date, we did a bit of analysis subsequent to this graph being presented, actually. We have, together with Ivan and the programmes, we've done an analysis of the spend profiles in the last quarter. And as a result of that, the NDR, or the National Data Resources, has allocated money back to Welsh Government of 900,000 revenue and 450,000 capital for the last quarter. Equally, the digital services for patient and public are going to accelerate some of their work packages in the last quarter, and they will be allocated a further 963,000 revenue and 276,000 capital. So we are seeing a switch in the last quarter in activity from the National Data Resource, but also an increase in activity in the digital services for patients and public. So, and those will be reflected, or those changes will be reflected in our performance charts for Q4. Okay, if we move on to the next slide. In terms of capital spend, as I already highlighted, we have spent to date £4.4 million in terms of capital. We have a residual of around about 3.6 million. Obviously, those numbers will slightly change now with the reduction in the NDR and the increase in DSPP, but they will be broadly in line with those numbers. Key in that is actually our discretionary capital plan. That is the direct capital that DHCW has been allocated. Within that, we have had delivery of the network equipment that is due to be installed at the end of the quarter and beginning of next year. That will actually enable the spend profile in the last quarter to increase significantly. So if you recall, earlier in the year, we were nervous about the lead time associated with this equipment. So that risk has now reduced, and we are now confident that we will be able to commit to that funds this financial year. We talked about the telephony infrastructure. We are also investing in some of our obsolete equipment, and we'll also do a small investment in a laptop. So from a DHCW perspective, I'm now confident that we will fully commit that money by the end of the year. In terms of our Digital Priorities Investment Fund, again, the focus there will be on the digital services for patients and public, as they've now increased their spend, and also the intensive care activities which are currently underway and are progressing well. So that in terms of capital, the outlook is a roughly 3.6 million spend in the last quarter. Okay, if we move on to the next slide. In terms of risks and opportunities, I highlighted the risk around energy earlier, and although this year we'll be able to mitigate that ongoing, that is a key concern and a key challenge for us at DHCW. Now it's clear from recent correspondence that Welsh Government will no longer be funding that risk centrally. In terms of opportunities for this financial year, we've highlighted the vacancy factor. We also anticipate additional travel and expenses in the last quarter. We are still working with the HMRC, and we're actually meeting with HMRC later this month, together with our VAT advisors, on the recovery of the Microsoft VAT. And we've done quite a lot of work around our provisions following the transfer from Velindre in light of our forthcoming year-end audit, which will shortly be amongst us. Please can you move on, Hannah, to the next slide. So in terms of the outlook and what activities we've been working on from finance for the IMTP for the forthcoming year, obviously we've had joint meetings with the Welsh Government, but also with directors of finance, directors of planning, the finance delivery unit, and also the deputy directors of finance, understanding the key assumptions and allocations for the IMTP. We are yet to have our full allocations finalised, so this is work in progress, but they did give clear steer on what they were anticipating our finance plan should include. So as I've already alluded to, those included mitigating actions to offset the inflationary costs, including energy. We should assume a core funding uplift of 1.5%. And again, there will be the savings target, which is in line with 2.5%. So we've got a significant challenge in that area as well to maintain our recurrent savings. We have to be clear on our benefits of where the investments, and be able to have clear trackers in process. Our discretionary capital, which this year was 2.3 million, will increase by 10% to 2.5. But prior to last year, it was 2.9. So although there is a slight increase, it's still below the level that we were anticipating, although and we're waiting for confirmation of those numbers. We should clearly understand our cost drivers, and they should have a good understanding of our inflationary pressures and cost pressures expected. For quite some time now, I've raised the risk around digital inflation, and I've detailed the calculations around that. So from a digital perspective, and also from directors of digital peer group perspective, that is certainly something that we're understood and highlighting across NHS and Wales. And our clear understanding of our underlying position has to be communicated as part of that. So we've done quite a lot of work around those requirements, albeit we're still awaiting really what those allocations are from our various funding streams at this point. Okay, next slide. So this is our timeline that in terms of delivering our financial plan in line with the IMTP planning assumptions for DHCW. January is a key time for us. We were looking to have our funding confirmed, and also, as we've already alluded to, we're working with the various health boards and trusts to inform them in detailed and get approval for the SLAs, that's the service level agreements we have with them. This year, that's quite a significant increase for a number of those health boards and trusts. And I'll show in a subsequent slide the detailed makeup of what's contributing to that increase. We are planning to have a draft plan ready for the management board to take the DHCW through all of those details. And previously last week we spent one of our internal development sessions understanding the cost pressures and mitigating actions that we have in front of us to deliver a balanced revenue and capital plan with the senior executive team. That draft will be ready in February, and obviously in March we will have full approval subsequent to us being able to finalise the numbers and present a balanced plan. Subsequently to that, obviously we would start then the internal delegation process. Now we have a full team of executive directors, and we took them through what that means, that process and the requirements for them in quite some detail last week. And then obviously we will load all of those into our financial budgets and start reporting for them. So we've got this is a busy month for us. Obviously in line with this, we'll be doing our year-end activities. So obviously we're working quite hard now to finalise some of the funding assumptions and then align our plans operationally to deliver those. And obviously there's some choices to be made in that process. So if we move on to the next slide. In terms of our financial plans, I've indicated to Welsh Government in the meetings that we've had, but also within the internal teams, there are three categories really of influences, financial influences that we have to build into our plan. The key one for us is the unavoidable pressures that we are now facing. Some of that relates to service growth and the fact that our growth levels within digital far exceed the 1.5% Welsh Government growth, funded growth, but equally digital inflation. And if you look at some of the SLA influences, but also some of our own influences from licensing increases and general costs, they are significant, and as they will be predominantly not centrally funded, that does create a challenge for us and for all actually finance directors across NHS Wales. Energy costs remain high and again will add to the exceptional cost pressures that we are seeing. And again, a key activity for us in the next 12 months is the data centre migration project. So we are working hard to do that, but there will be a requirement for non-recurrent revenue and capital to enable that to be done successfully within the next 12 months. So together with Sam Lloyd, we are looking at are there any choices around that and what we need to do as a bare minimum to enable that to happen. So for me, those are pressures that we can't avoid. They are essential things that we will need to do as DHCW and will need to be funded in the next 12 months. Then there are some necessary investments, and some would argue, certainly with the next one, that it's obviously unavoidable, but it is also necessary, is the cyber. We've got, and we'll see that later, a detailed cyber plan, and we'd like to tackle that at pace. Again, there are some options and some choices around at what speed we undertake some of those. And again, the digital priorities, the developments we've already instigated and delivered on are now transitioning to operational service, and again transitioning those services in a cost-effective, sustainable way is proving challenges, but there may be some choices that we have to make around the service levels that we can provide in that particular arena. And finally, there are what I would call choices. Obviously we're keen to move to cloud and would like to do that at pace. But our ability to afford to do that at the pace we would like to run will be a challenge. And again, supporting other initiatives that as new directors, I'm sure you've all got, we are also considering options around what we can do in the next 12 months. The one area that isn't included on this and actually wasn't included in the month is obviously the transition of Lincoln RIS. So in the last quarter, we will reflect that in our financial books. And again, we're working hard with the teams to understand what that will mean for us from a financial requirement for the next 12 months. So that's also an area that we're working on. And to lead on it a bit more detail, sorry, next slide. In terms of what this means for health boards and trusts, so to give you a flavour of what we're working on, As you know, we're challenging to get a sustainable funding position. So in a very open, transparent way, we've been working on the transition of projects into business as usual. Some of those have been approved, signed off and agreed by health boards. That would include, for example, the Microsoft contract and the Centre of Excellence. We're still yet to fully sign off the Welsh Nursing Care Records transition. So there is work to be done to finalise that and secure the funding. But equally, we've identified as part of our costing exercises, but also reflecting the inflationary pressures that we're seeing, a need for additional support through the SLA for the pharmacy, the Welsh Patient Administration Service, and the key one, which is really the area of greatest focus, I suppose, at the moment, is the what we've called National Infrastructure Growth and Network Resilience. That really reflects the ongoing costs, basic SLA costs that we now need to support the organisation going forward. In future years, obviously, it's a 3-year plan, so we've also identified further areas that we need to build into the sustainable funding model, including WPAS and a few other areas. And also, there are other things that we now need to consider. Microsoft licenses, that those that haven't got those all into the plans, the LINK program and the RISP is the other areas that again we're working on to understand what that means and what the implications of those are. So that gives you a flavour for some of the work that we're currently working on together with our colleagues in DHCW, but also across Wales to validate and get a full understanding of what our funding will look like in the next 12 months. Okay, so if you move on to the next slide, Hannah. So, to summarise then, I've talked you through where we are at the end of December. We've made great progress. The last quarter is going to be busy. We've got a lot of development activity in particular to deliver on our financial, capital and revenue plans that we're working on. Our COVID activity has fallen back in the last quarter. I think focus is now on what does that look like for the forthcoming year, and what's the funding allocations associated with that, and similarly with the Digital Priorities Investment Fund, given our operational backdrop and working very closely with the new digital officer in Welsh Government to get the right balance and the right affordability about development and also the operation in ongoing costs. And I'm also working alongside our health boards and trusts and the directors of Digital Peer Group to understand and translate our pressures and their pressures to inform that decision making and choices really that we will have to make in the forthcoming quarter. So I'd like you to note the comments of the position at the end of December and of where we are in relation to the forecast for next year and the financial and risks and opportunities that we've already highlighted. I should note, and we'll come on to risks in a minute, that we have now reflected those additional funding risks in our risk register. So happy to take that here, or maybe Chris will take that up in the next section. And yeah, I'll open the floor to questions now, Chair.
Thank you, Claire. I've got a few actually points, but I'll let's just see if others pick them up before I come to them. So I've got Marion and then David and then Rowan.
Thank you, Chair. Really positive, Claire, to hear that we are forecast to balance the books at the year end. Always good to hear. But I note from the core revenue performance on page 6, I think it is, of the report, there are a couple of directors reporting underspends, but there is a forecast significant overspend in ICT. And you do mention that you commissioned an external review. Look into opportunities for benchmarking, etc. I just wondered, could you comment on your thinking behind that and what you're hoping to get out of that external review once it's completed?
Yes, thank you, Marion. Yes, this is a review that Carwyn commissioned to look at and understand where our resourcing currently sits and whether it was sat in the right place and whether it was over or under resourced. So we haven't had the full report yet, it's true to say, but we would hope then that would be able to justify whether the budget that we've set for ICT is right, and whether it's the budget that is causing the problem or whether it's actually the funding or it's the level of resource that's
Okay.
the issue. And I think there's probably truth in both of those areas. So that would then inform what we need to allocate for next year in order for them to be able to deliver their activities within their current budget.
So can I ask one of my questions at this point then, because it relates to this, because I couldn't get my head around this. In the other areas, we're under recruiting and we're under established. The overspend in ICT is identified as pay pressures.
Yeah.
So does that mean we're actually over established against budget? So we've got more, it's not a recruitment problem, right? So we're actually, the budget does not reflect the human resource establishment within ICT.
Yeah. So
okay, I understand.
Yeah, that's absolutely right. So
okay. Thank you. And David.
Thanks, Simon. Thanks, Claire, for the presentation. Really clear as usual. Thank you for that. I've got two questions. Firstly, you mentioned a saving on the NDR programme, both of revenue and capital. Is that just a phasing issue? It's money we'd planned to spend this year, which is now going to actually occur next financial year?
Yeah, and I'll bring Even in that here if he wants to comment on it. But yes, the NDR programme, as you know, has got a significant amount of activity actually in the last quarter with the building of the platform and the enabling of Google. I think it's true to say that they are now looking at the deliverability of all of that in the last quarter. So there may be some slippage into the following year. Having said that, they're also developing an ongoing business case for their requirements, and they're working alongside that. So most of that is slippage into next year, but it'll probably be incorporated into the new business case they're currently developing. Okay. Even I don't know if you wanted to add anything.
Well, only briefly to say there is a sprint on in the last 2.5 months of the financial year, having completed the Google Cloud Platform contract just before Christmas. There's a plan in place to do that. It's a challenging plan, but that takes us effectively to the end of phase 2 of the NDR, and the phase 3 business case is we're in discussions with government and presenting that, and that I think is coming. I think it's coming to the board for information at the next public board in March. So you'll see that, and that takes NDR into the next phase, which is really the delivery phase, the data product and delivery phase. So I said earlier that this is a really important year for the NDR. I'm taking a lot of confidence from the close working with local health boards on local data resource facilities. Again, there's a sprint on that as well at the end of the financial year. So Claire and I have both been working very, very closely with Rebecca and with the program team since probably about mid-November, just to really challenge the speed at which it's going in at the year end. So we've got really clear sight of it. It's challenging, but everyone is on it at the moment.
Okay, thanks for the clarification. The second question I had, Claire, was buried within the report that goes with the slide pack against the sustainable funding issue that we've got. You've got a sentence which basically says, reflected within the organisational IMTP financial plans for all Wales digital services and products. I'm just trying to clarify what that means. So we've got an issue around the ongoing funding of digital services funded by DPIF. Are you saying that the service costs for those, which need to be sustainable, is going to be incorporated in the IMTP? Have I understood that correctly, or am I putting too much of a positive spin on things?
No, it's as a program transition, as you can imagine, it's a 3-year plan. So across those 3 years, and we just talked about rephasing of NDR, those programs will transition into business as usual. As they transition, they will then become part of the SLA charges that we put onto health boards and trusts. So there is so we are depending on and again it very much depends on when these programs end. And for some of those now, it might well be that they don't end in that 3-year window. It will impact on the SLA charges that we've got to reallocate to health boards and trusts. So we are working alongside Welsh Government and with the health boards to forecast what that looks like, and then for them to validate, and then they need to incorporate that into their annual plan. So it's quite complex, and obviously as we've just alluded to, some programs are now forecasting a later finish, so that will also impact on our SLA projections. But yeah, so our plan needs to reflect when the when the DPIF programs within that 3-year window are due to be finished, and then we need to reflect then what the anticipated ongoing support cost needs to be, and what that then would need to be reallocated to health boards and trusts. And that's that we've started that process, and we've given them insight into that, and now we're working through those SLA agreements with the health boards and trusts. I think it's true to say they're probably focused in the next 12 months, not the next 3 years, which is why there is a bit of a short-term focus from their perspective. What I'm trying to highlight is it is a 3-year plan, and we need to do a 3-year plan. So it is a bit more complicated than that.
Thank you. Rowan.
Thank you, Chair. Claire, I just want to kind of dig into the consequence of the digital inflation across the whole system. So we're obviously investing in services and standing them up, and then our health boards are investing to deploy. And it's obviously really important that they can do that for clinicians and to have the benefit of them. I think we all recognise that there's probably been underinvestment generally in that, and there are other challenges, I think, in the system that you'd want to see more investment. How are they balancing perhaps the appetite to do it more and invest more against the inevitable sort of inflation eating that uplift? Are we going to see a change? Because we are hearing strongly the challenges that do exist in the NHS in Wales at the moment.
Yeah, so there's quite a number of layers to that. So there's a couple of things. First of all, I think it's not just digital. Inflation across the organisation is creating challenges and is reducing the amount of available funds to allocate to core services. So it is inevitably leading to a number of choices to be made as to where you can invest. There is an underlying challenge for health boards because of their for all of us in terms of our legacy, our systems legacy and our technical legacy, as well as a backdrop of a high cyber risk and an increasing cyber risk. So when you add all of that together, there is inevitably not enough funding to cover all of those different aspects. And at the same time, we've got a strong pipeline of development coming through that needs to be deployed and operationally integrated. So at a time like this, I think we are working with the directors of digital to really understand the whole system context and to present together with Welsh Government those choices that we need to make as a system. And I think there will be some difficult choices to make at a time when we may not have the headroom to run at the pace that we would want to do development in. So I think there is, I can't give you the answer yet, Rowan, because we're working through those choices as a group, but there will be some challenges as to how we square all of those off, and that we may have to reduce the pace of development to enable the operational reliance and reliability and deliverables to happen. And that's not a choice that we would make as DHCW necessarily. We need to make it as a system, and those are we're currently looking at what are the options we've got, what are the costs, and I think from the work that we've done, that is very clear as to what the costs are and why they are. And there is very little challenge around the cost pressures. There's more acknowledgement and acceptance. The problem is the affordability of those, together with the rate and pace we want to run at development, because we know digital is part of the solution for the NHS in Wales, and to enable it to strengthen its operating position through the next couple of years. So it's very complex, but yeah, we're working on what those choices are and how we can all agree, if we can, the best way to allocate the funding that we have got.
No, and it's going to be really, really difficult in the future financial environment to keep everyone on the same page, isn't it? And on this one, because of understandable cost pressures that they're on, and things like limited capital, and doesn't help the situation at all.
I appreciate that, and Claire, I would just ask you to kind of try and build that into some sort of sensitivity analysis, because I think it's going to help with the balancing between digital is the solution to change some of this versus investing money in something that actually can't be useful.
So I think there's a couple of things for me that come out of this. One is we really have to demonstrate the value that digital creates, and that's not necessarily financial value. It'd be patient journeys, service availability, etc. There's another bit to this as DHCW. We have to demonstrate the value we create by doing what we do in the most efficient and effective way, and there's also that aspect to it. And I think that's the bit that we can control directly. We can also then start demonstrating the difference we can make in some of those system decisions, and that's probably something we're not particularly good at articulating well yet, and we need to get better at it.
And in theory, and one hopes in practice, this process is something that the NHS exec could well play a useful and helpful part in, and the role of the CDO within the exec in terms of that voice around keeping everyone together, the system together on where investment is needed and where development is needed.
Yeah.
I have got 3 points that I am going to ask, regardless of how many other people ask questions. But I've got Alistair's hand up and Helen's hand up.
Simon, were you asking me to go next?
Yes. Yeah, I'll come in at the end, Alistair, because you never know, you might ask the question I'm going to ask.
My apologies for missing the beginning of this, and if I'm repeating a question already asked, please just tell me right away. I'm just interested, Claire, have we explored the scope for avoiding unilateral DHCW only contracts or Wales only contracts, as opposed to the potential for joint contracts within the United Kingdom or within the scope of other contracts within the United Kingdom? Or is that simply not feasible given the focus that we need to apply it for in Wales?
So we do use Crown services, which is I think it's a national procurement requirement. So we do piggyback and work alongside our colleagues to ensure value for money where applicable, because there is also some organisations that don't run at a national level. But at the same time, I think it's true to say we have a social economic responsibility. So we do try to nurture and support local Welsh organisations wherever that's feasible and economic and be justified. So it's a bit of a mixed bag, I'm afraid, Alistair. We do try and use national where that's right and applicable. But we also, at the other extreme, try to also nurture the social economics benefit of the Welsh pound by spending it in Wales as well. So there's a bit of a cross section in terms of our procurement strategy.
Helen.
Yeah, it's just picking up on the point you made, actually, or and a couple of people have made. I think the conversation with the new chief digital officer and now the work to establish the NHS exec, the conversation, as you rightly say, needs to be at that level. And there are some tough choices as a system we're going to need to make over the next year, or possibly 2 years. And those are the conversations that we're having. We are really fortunate to have the granularity and the intelligence that Claire and the team have pulled together, in terms of being able to describe the extent of the problem and actually the opportunity. And I think there is an acknowledgement, and we would acknowledge that we need to do more in terms of being able to describe the value and the range of opportunity that there is. And that's some of the work that we will pick up with the broader digital leadership and with Mike going forward.
Thank you. Now, the 3 bits I had, Claire, one of them, you will know what I'm going to say, because I'm a bit like a cracked record, but it's so important. It's around the recurrent and non-recurrent savings, and the huge risk in there, and something that we need to be cited on. And I think it would. I know we've got a slide on what the non-recurrent and recurrent savings are in year, but I think it might help, particularly as we move into the next financial years, if we had a cumulative calculation, because at some point we might fill all the vacancies, and then we've got ourselves a huge problem because we've got a big non-recurrent saving that we're going to have to find somewhere. So I think it might be helpful just to have that cumulative year on year, and we're in a fortunate position, which virtually no other health organisation has been able to be cited on that, because we know we started so recently. So that was my first observation. The second is where is your, I know I've got experience of this, and I know they're so difficult to deal with. Where is your level of confidence in terms of the VAT and getting the VAT? And it may well be that you say, I just can't answer that with HMRC. And the third, and I may have imagined this, but I am sure someone told me that we were expecting the Welsh Government to give us the financial allocation on the 23rd of January. Was that the date? I'm sure that I remember that date for some reason. And where are we in terms of an understanding? And again, you probably won't be able to answer this, but I think it is important that we highlight this publicly. Where are you in your understanding of when we will get that allocation?
Okay, so the first one, yes, a common theme: recurrent and non-recurrent savings on our strategy around delivering those and having visibility of that. I think that's really important, and it's something. I'll give them a tip now. We've got directorate reviews coming up. It's going to be a common theme through the directorate reviews as to what are our strategies around recurrent savings, because they take time to develop and deploy effectively. And I think our estate strategy is an example of that will come into form. That'll be a recurrent saving, but again, takes time to position, develop, deploy, and deliver. The HMRC, we are meeting with. They are actually meeting us. I think it's the end of next week, and they have sent us a response on a number of questions in relation to our claim. So we're working through those with Carwyn and the team. So I think we're getting to a better position of knowing of them making a decision. They're highlighting resource constraints, which is why it's taken this long. So I don't know is that the answer to that question, I'm afraid, Simon, but I think we'll have a stronger position within the next couple of weeks on where we are with that. In terms of our allocation, you're right. I did tell the board that we would have it by this board and I would be able to give it to you. Unfortunately, we don't. And there's a number of reasons. I think I said I wasn't going to be holding my breath. That was my... Yeah. So there's a number of reasons for that. One is we have a complex funding system. We've got quite a number of funding streams from very different policy leads, etc., within Welsh Government, and we're working through those individually. Some we had this morning, I think, so they are coming in, but I don't have a complete picture, and I certainly don't have formal notification of where we are with the funding at this point, which is disappointing, but I think it just reflects the complexity and actually of where we are. I have to say I've had regular meetings with Mike Emery, and I've been taking him through our financial position and some of the leading indicators. So we are working together to come up with a solution and the allocation as quickly as we can now. But I think I wouldn't like to put a date on it, if I'm honest, because it is complex and it is somewhat dependent on the last quarter in relation to some of the digital priorities investment funds. And as we've shown, they do fluctuate, and they do fluctuate materially. So again, working alongside Welsh Government in enabling us to understand what that looks like will help that. And that's what we're currently doing.
And I think it's important that we as a board, and I'm sure Marion will take this through the audit committee as well, are cited on the risk. And we had this risk in this financial year of moving into the financial year with our plans without the comfort of a formal identification of what allocations we have for whatever we need. I think we just need to be cited on that, and we need to recognise that it's a risk that to a huge extent is out with our control or out with our mitigation.
Yeah, So what
Okay.
we are doing, sorry, with those assumptions, we're now working through what we think our allocation is, and therefore going on to Rowan's important comment, was then understanding the risk around those and the sensitivities and choices around those. So we are trying to work proactively to then be able to respond quickly once we know we've got confirmation of those.
Okay, thank you. Helen.
Yeah, just on that point, and I did raise it at the leadership board, the NHS Wales leadership board earlier this week, in terms of when we would expect to have sight of our allocation letter. The health board's out there is prior to Christmas. So colleagues in Welsh Government are aware. I think, in fairness, that there is quite a lot of work, and given the size of our budget comparatively with others, actually it's quite complex, as Claire has described for us and updates us on. But I think also with Mike Emery starting this month, I think there are, you know, further conversations that have been had within Welsh Government, within the department, to try and land the position, and they're still ongoing. The promise from Steve Elliott in the leadership board was that we would get it in the near future.
Right, okay. I would ask in the definition of near future. Any other comments? Thank you very much, Claire, for, as ever, a very clear explanation of where we are, where we are in terms of our financial position, and encouraging that, more than encouraging that we're heading to balance this year, but obviously some significant challenges and risks moving forward into the next financial year. So thank you, Claire. Thank you to your team as well. And if we move then on to item 6.4, the corporate risk register, and I'll invite Chris, the board secretary, to introduce this item. Chris.
Thank you, Chair. Yeah, I'm just going to start by noting the risk and board assurance forward work plan for 22-23, which can be seen as item 6.4i. Just wanted to pick out that we are in the process of reviewing the strategic missions as part of our IMTP process that Ivan is leading us through. This will inform a board development session we have planned in March for the board to review our risk appetite, risk tolerance for our operational domains, as well as our risk appetite for each of the strategic missions. So that work's happening, and that will feed into the session planned in March. Just to give some global context, the global report from the World Economic Forum for 2023 has recently, within the last week, been published. And I will bring some key considerations from that report for the board development session and the board meeting in March. There are a lot of global trends that are highly relevant, I think, to our organisation and the context within which we work. The 2022 report, you'll recall, highlighted the huge emphasis and shift to cybersecurity, the growing international threat. And just to pick up Alistair's point from earlier, cyber does form a huge part of our risk profile. I think over 30% of our corporate risks relate to cyber security. And as Sam noted earlier, we'll be considering the cyber investment case later on in the private session. Just to talk through the current corporate risk register position, there's currently 23 risks on the corporate risk register. There's 14 that are set out in board papers today, 9 risks which are classified as private. So 7 of those will be taken at the Digital Governance and Safety meeting next week, and there's 2 that will be considered in the closed session of the Audit and Assurance Committee on the 14th of February. I just want to note for board members some of the changes that have taken place since the last meeting. So you'll note there's a new risk that has gone on, DHCW 0300 CANISC screening and palliative care. So Ridian's approved the removal of the previous CANISC risk and the amended risk with that brackets, just to distinguish between the 2 risks following the work with the Velindra Cancer Centre in November that we talked about at the last meeting. There's 4 risks that have been removed since the last meeting. 0295, that risk reduced at the last meeting and has now dropped off the corporate risk register. As I mentioned, the CANISC risk has also come off since the last board meeting, replaced with the new CANISC risk. There's 1 private risk that has been removed, and there's 0295, the power outages risk, that has also come off since the last meeting. There's no new risks that have come onto the risk register for this meeting, but as Claire mentioned earlier, she has recently approved 3 new risks from her area. So one, Welsh Government core income, primary care income, and NHS SLA income. So these are in addition to the long-standing cyber and data centre migration funding risks. So Claire, I don't know if you want to mention anything about those now.
I think that really reflects the conversation we've just had. It's really the SLAs around affordability. Primary care, again, is about inflationary pressures and their ability to support those. And then the final one is really about our core uplift and looking at the rate of growth and inflation that we are highlighting. Now that it's clear from Welsh Government that inflationary pressures will no longer be funded, I think it's important as a board we're cited on the risks that we now carry as a board to balance.
Thanks, Claire. Just to note, as was the case last month, Link is our highest risk on our risk register. The one distinction, obviously, in November, it was due to transfer. That transfer took place on the 1st of January to DHCW. There's a deep dive into the staff vacancies risk that will happen at the Audit and Assurance Committee in a couple of weeks' time. So to update particularly on the work of the Strategic Resourcing Group in helping to mitigate that risk over the last few months. And then 2 other risks I just wanted to highlight, both of which will get some considerable discussion, no doubt, at the Digital Governance and Safety Committee. The first one is 0264, the data promise. And just to note the date, I think it's the 31st of January, when a discussion with Welsh Government is planned to take place to kind of agree next steps in taking that forward. So that's positive because that has been on for a little while. And the second one is 0269, the switching service. Again, that risk has been on for a while, has had considerable discussion previously. An internal audit report, which is in draft, it will go to the audit committee in February. That has been considered and an approach to mitigating the risk discussed, and we're in the process of trying to probably break down the risk into a number of areas around disaster recovery, business continuity, and then the forward work in terms of NDR and a potential longer term solution. So that's helpful in terms of that report and the reflection. The ownership of that risk has always been something that crosses a number of portfolios. So I think the approach is to try and break it down so there's ownership by portfolio, which will help us to mitigate and track the mitigation through. Chair, those were the key points I wanted to raise today, but happy to take any questions.
I just got one before I ask if anyone's got. In the data promise one, the actions to date, little 4, the last line, aim of launching the data promise publicity campaign in 2022. Should that be 23?
Yeah, 2023. Originally it was the back end, but that should be 2023. Yeah.
And also probably, if it's at all possible, as things move on, it might be helpful to pin down when in 2023, or to have some sort of milestone, because it's rather a long time frame, 2023. Alistair.
Thanks, Chair. Chris, I'm assuming we've got a current rating of red and the target rating of yellow. That's due to supplier proposed delays rather than, so it's a time lag issue rather than any other issue that we should be concerned about.
For which one? Sorry, Alistair. For which risk?
I'm looking at, sorry, I'm just trying to pull it up. Business and organizational, showing as red, that's 0298, showing as red rating currently, but yellow target.
The link, yes. Sorry. Ivan, do you want to comment on this one? This relates to the link potential delays. Sorry, I was just trying to establish which one it is, but it's the it's the link risk.
It's the very top one. It's just due to the delay in the contract and supply.
I'm on mute and I can't track down which one exactly.
It's the very first one in the register, Ivan.
Yeah, it relates to the
they don't run numerically, unfortunately. It's the very first one, which is around Link and the delay in implementation of Link.
Sorry,
and
I was jumping ahead to the local partnership report.
Helen, do you want to come in whilst Ivan?
Yeah. Well, I track it down.
Page 203 in the board.
Helen,
book.
you'll probably be as I could cover this off, but let's Helen. I couldn't. Helen, you do it.
So the risk that we've got there is the risk to the current system, and the fact that if we don't, if the Link programme doesn't deliver within the timescale, that we would have an invalidated laboratory system. So that's what that is at the moment. So it is, the risk is to do with WLIMS as a consequence of what may happen with Link, where the risk is with Link. The programme are currently doing a full review of the risks since they've transferred to us, and there is a risk that is on every delivery organisation risk register in relation to delivery of the Link programme, and a number of factors really, one of those being delivery against contractual milestones. So there's probably a lot of detail that we can go through, Alistair, and we will perhaps pick that up in the private session. But yes, so there'll be more risks, I would imagine, coming on to the risk register next time we review it in relation directly to the Link programme.
Yeah, and as Chris, I think you said right at the start, it has established itself as our biggest risk. I think you mentioned that, and very much so. Anyone else got any comments or questions? If not, thank you very much for again a very clear setting out of our risks, and also I think to be commended in terms of the way in which it is very much a living document, because if it isn't, then it doesn't mean anything and it becomes an irrelevance. So well done, Chris, and all those involved in putting that together. So if we receive and we ought to be noting it as well, the corporate risk register. If I then move on to item 6.6, which is the local partnership forum highlight report, and I think Helen, you were in the chair for this particular meeting rather than Andrew. So over to you, Helen, if there's anything you'd like to, any specific points you'd like to pull out from the report.
Yeah, thank you. Yeah, really good discussion again at the forum, and you can see we talked across a range of areas that are pertinent to staff for the wider DHCW team. We talked a bit, as you can imagine, got the updates from our union colleagues on where we are on industrial action, and we've got, I believe, a further session on that as a board, in a briefing session coming up shortly, where we'll talk more about that. At the moment, we're not anticipating huge risks of industrial action at DHCW, but again, ballots are continuing amongst our relevant unions. And Sarah Jane will be able to give us more of an update when we cover that session to come. And we also talk quite a bit about hybrid working policy and the way that we're working, and actually that relates to the other bit, just to pick up on what that means for our estates plan as well. And we've had these conversations as a board as well, haven't we? So we had quite a good session on that in terms of the, how we're working at the moment and what that means more broadly for the way that we want to organise our estate to service the needs and what we're hearing from our staff in terms of what their requirements are. So yeah, really good discussion as ever, and Andrew will be in the chair for next time.
Thank you, Helen. Any questions, comments, observations? No, we move on to the IM Digital Network highlight report, which I was due to be at the last meeting, but for a sad family reason was unable to attend. I know David was there, but he actually stepped down from the chair because you had no voice. So David, I'm sure you have the voice doesn't impact your recollection of the meeting. Is there anything you want to draw out, particularly highlight from that meeting?
Yes, thanks, Simon. I'm glad to say my voice is recovering. Still not quite there yet, but I'm well on the mend. Thanks to Maynard for stepping in. There was two things I just wanted to pick out over and above what's in the report itself. The first was the presentation we had from Jamie Graham around the recent cyber incident that affected a third-party supplier. Jamie talked us through the timeline of detecting it and how it was managed through to closure. And he also described the excellent work that was done to stand up an alternative system to be used while the system that was offline. I have to say there was wide praise from the independent members from all of the health boards in terms of 2 topics. Firstly, the speed at which we detected the fact that there was a problem and took action. That was really impressive in terms of our speed of response. And then secondly, the timeline around us standing up a replacement service was again exceptional, and there was widespread praise from our colleagues in the health boards in terms of our performance in detecting it and then standing up an alternative. So that was really well received. And Sam, maybe you'd pass on my thanks to Jamie. I did so at the meeting, but just please mention that I've raised this in the board meeting. And then the second thing I wanted to raise was around the presentation we got from Hamish, from Caddy and Dewey on digital inclusion, which we touched on a little bit earlier in terms of a key facet of our NH Wales app. There were some really good examples of work done by Howard Dar and Betsy in terms of what they're doing on digital inclusion, which left our other health board independent members in a position where, oh, why aren't we doing something similar? And I think the network has done a good job of highlighting and showcasing some really good work in 2 of the health boards. And there will be some questions raised at the next board meeting from our independent member colleagues around what are we doing in this regard. So I think that was, again, a really good use of the network. So that's my summary, thanks.
Thank you.
That's questions if there are any.
Thank you, David. Rowan has a question.
So not so much a question, but just a comment, which is I think the this network has been really useful in bringing us together and everyone realizing that their challenges, they have them in common. And I think they value an opportunity just to have that reality check, and also you know, the just confidence that comes from recognizing these are common challenges. So I think David, you've done a great job of chairing its first year, and I think it's delivering value.
Thank you very much, Rowan. Sorry, I just had something on the agenda. Any other questions, comments? Obviously, there's going to be, as is required, we're going through the process now, David, of working out how we do the review of the network. But I think from the reports that you bring to the board and other conversations I've had, it and the sort of comments that Rowan's made, it has been a remarkably useful bringing together of people for all sorts of different reasons, showcasing and disseminating information quickly around the digital agenda has been very helpful indeed. Okay, so I haven't got any other urgent business communicated to me. Does anyone have any that they want to raise? No, thank you very much. And then the date of the next meeting is Thursday, the 30th of March. And I'll bring the meeting to a close now. Thank you all very much for your contribution through the meeting. We've ended slightly earlier than I expected. So if it's convenient for people, we do have a private meeting, which, as members of the public watching this will know, it deals with issues around cyber. That's the only real reason we have, other than commercial confidentiality, private meetings. That we were scheduled to start at 2:10. We could start at 2 if that suits people. Okay, we'll start again at 2 o'clock. Look forward to seeing you all there. Please remember to oh, do we log off for this one, Chris, and log back in?
We do, yeah. There's a separate Teams link.
Okay, so if we log off. So thanks everyone. Goodbye.